Good morning and welcome to the Wednesday, January 28th meeting of the Joint Standing Committee on Health and Human Services. This morning on our agenda, we'll have an update from the department on the non-emergency transportation services and ongoing requested updates from the department and others that this committee has requested. That will be followed by a work session on LD 1835. We'll then break after that and return at 1 for several public hearings. With that, I will turn to our committee and ask that they introduce themselves. Representative Graham.
Thank you, Madam Chair. Good morning, everyone. What a beautiful, chilly day we have in Maine today. I'm Representative Annie Graham. I serve the people of North Yarmouth and the Majority of Gray, House District 105.
And good morning, everyone. I'm Representative Lucia Daigle, and I represent House District 1, and we have a discussion in our committee about which is the prettiest place in Maine, and usually it's House District 1, but today I'll defer to Kathy Javner's Katahdin and Mary Ann's Down East.
Thank you.
Hello, good morning. My name is Flavia De Brito. I represent House District 64, which is part of Waterville and part of Winslow.
And hello, everyone. My name is Sam Zager. I'm honored to represent District 116, which is part of Portland.
Good morning. I'm Mary Ann Moore, and I represent Senate District 6, which is all of Washington County, along with 16 communities in eastern Hancock County as well, down East Maine. So there you go.
Hi, I'm Michael Lemlin. I represent House District 53, which is Chelsea, Randolph, Pittston, and Dresden.
Good morning. I'm Representative Dan Shigori. I represent House District 55, which is the communities of Hollowell, Manchester, and West Gardner.
Good morning. My name is Julie McCabe. I represent District 93, part of Lewiston.
And I'm Representative Michelle Meyer, serving Southern Maine's District 150, which is all of Elliott, where I live, and parts of Kittery and South Berwick. And I am honored to serve as this committee's House Chair. So joining us from the department on Zoom today is MaineCare. Oh, I'm sorry. I'm sorry, Molly, 1 minute. We also have our committee member, Representative Griffin, on Zoom. Sorry, Abby.
Oh, no. Good morning, everyone. My name is Abigail Griffin. I represent House District 34, which is Glenburn, Levant, and Cadescag.
Thank you. Sorry about that. We also have our committee clerk, Sophie Dubé, to my left, and joining us as well is our nonpartisan analyst, Sam Seneft. Okay, we'll turn to this update from the department. On Zoom, we have a MaineCare COO, Molly Slotnick, and we also have a memorandum in front of us. So if you would be so kind as to introduce yourself, and then we can go through the memorandum, take some questions, and welcome. We're happy you're here.
Good morning. Thank you. Representative Myers, members of the committee, thank you for having me this morning. My name is Molly Slotsnick. I'm the Chief Operating Officer for the Office of MaineCare Services. I apologize that I'm not there in person. I am homesick today and did not want to infect any of you. So hopefully this will all go well over Zoom. So at the request of the committee, I am presenting a report that you now have in front of you related to non-emergency transportation services for MaineCare members. This follows the monthly reports that we have been sharing with the committee since September 2025. As a reminder, the department manages non-emergency transportation through a brokerage system. We contract with brokers who match MaineCare members with local transporters to get them to and from their appointments for MaineCare services. The brokers contract with local transporters across Maine and are accountable for managing the cost and administration of the transportation program. The program provides about 2 million trips annually. We currently have 3 brokers across 8 transportation regions, and you can see at the top of this memo the 3 brokers and the counties and towns that they serve across Maine. The first part of this report is an update on ModivCare's bankruptcy proceedings, which you've previously heard about in our prior monthly reports. On December 29th, ModivCare emerged from bankruptcy with a court-ordered plan for restructuring. This plan can be made available to the committee if you're interested. As a condition for ModivCare to emerge from bankruptcy, it is required to hire independent companies to perform annual audits, financial audits. The first audited financial report will be available to the department in April or May later this year and annually thereafter. Prior to ModivCare emerging from bankruptcy, in order to protect state funds and limit risk in the event that the proceedings did not conclude as ModivCare expected, the department required that ModivCare increase performance and payment bonds from 10% to 15% of the contract value. ModivCare complied with that request, and the department is now in possession of those bonds, and we will maintain those levels of bonds moving forward, even though the bankruptcy proceedings have concluded. Throughout the process, MaineCare has proactively increased routine oversight in a number of ways that we will continue, including weekly reviews of ModivCare's payments to Maine transporters and MaineCare members receiving mileage reimbursement to ensure timely payment from ModivCare, and weekly standing meetings to discuss performance, payments, complaints, and other oversight needs of the state. Our monitoring of ModivCare's payment and trip information from December 1st to mid-January continues to show uninterrupted service and payments to members. Below, we have some of the metrics that the department has tracked. Over $500,000 verified paid to MaineCare members for mileage reimbursement. Over $2.5 million verified paid to Maine transporters. Payments over the last number of months are consistently over $2 million per month since we started monitoring. There has been no disruption of transportation services in any of ModivCare's regions during the bankruptcy proceedings. The department has not received any complaints from any transporters about non-payment since the beginning of the bankruptcy proceedings, or prior to that, I should note. We have also not seen any spikes in ModivCare's complaint rates. It remains steady at 0.07%, which is an exceedingly low number. The next section of this report is about our monitoring of all broker performance. So we receive metrics every month from all 3 of the brokers across all 8 of the regions that they serve. As a result of discussion last spring with this committee, we now post quarterly broker performance and complaint data reports on our website, and the link is there if you'd like to take a look later on. The chart below is the latest data that we have for December 2025. Just a few notes about the chart. The second row that shows ModivCare Region 2, that is Washington and Hancock counties. There's a little bit of a footnote there about Down East Community Partners, and that second row is actually a subset of the first row. So the first row shows all 5 ModivCare regions, and then the second row is only ModivCare Region 2. Below the chart, you'll also see the contract requirements. So these are the performance levels that the brokers are required to meet according to what is in the contract. And so each of the columns in the table equates to one of these contractually required performance metrics. So you can compare the numbers you see here to what is required in the contract. I'd also like to point out that the column towards the right, complaint rate, I'd like to point out a few things about this column. The complaint rate is what is measured as a performance metric against the contract. So it's a percentage. We measure it as a comparison of the number of complaints against the total rides performed, the total trips for that same period. So it is a percentage. You can see that for all of the brokers, the number is incredibly small, hundredths of a percent. These brokers provide tens of thousands of rides every month, and the number of complaints that we receive against those tens of thousands of rides are incredibly small. So it's important to look not just at the number of complaints, but the number of complaints compared to all the trips taken. And then I'd also like to note that both the missed trips percentage column and the complaint rate column for all 3 brokers are well under the contractually required performance metrics. So that's 1% for missed trips and 1% for complaints. Everyone is well under there. well under the requirements. During the first 3 quarters, just to give you a sense, so you have in this in this table, the number of trips for just 1 month for each broker. For the first 3 quarters of calendar year 2025, the 3 brokers together arranged for over 1.3 million trips. And then the last section of the report that you have here is the status of the procurement award appeal. So 2 bidding agencies, Penquist Cap and Waldo Cap, appealed the state's decision in a competitive procurement process to award the NET contracts in all 8 transportation regions to a current broker, ModivCare. That RFP award came out a few years ago, and then the appeal followed. To date, the contract award decision has been upheld through 2 levels of legal appeal, an administrative hearing, and then a review by the Superior Court. Those decisions have been further appealed, and the final opportunity for appeal is now before the Maine Supreme Judicial Court. Oral arguments for the Waldo Cap appeal have been completed, and the appeal is pending decision. And the Penquist Cap's appeal is scheduled for oral arguments next week. And that is this report. I'm happy to take questions.
Thank you, Molly. Question from Representative Zager.
Thank you very much for walking us through that and compiling the report. I was comparing the chart that you shared, which is from this last month, December 25, with the same chart, basically from which was shared with us earlier this month. This is the performance metrics average January to March of 2025. So comparing the first quarter, as previously shared, with what you just shared, which is 1 month ago's data. And a couple of things that I noticed is that the complaint rate, as you said, is reported as extremely low, 0.07% for ModivCare, and same ballpark for the other Waldo Cap and Penquist Cap. What I noticed is different is that the missed trips is significantly less. There seems to have been a remarkable improvement in how many trips are missed. You perhaps don't have the data in front of me that I have, so forgive me.
I actually do have it in front of me, so I'm looking at the same thing you're looking at.
Great. So for instance, the Penquist Cap favorably fell. Missed trips was 692, and this is reported as the average monthly, 692 missed trips, January to March, and that fell to 135 missed trips out of roughly the same number, roughly 50,000 trips, which is a huge improvement. And I'm wondering, and for ModivCare, it was a halving of missed trips. With 83, 90,000 or so trips, it actually the rate significantly improved. So more trips and fewer half as many missed trips. So in both ModivCare reported data, Penquist, and same with Waldo Cap, there's been significant improvements. I'm wondering what happened. Why are things so much better?
I don't have a ready answer to that. We could go back and ask. I'm looking at, so I can see that you're looking at the number of missed trips, and also important to compare is the percent of missed trips between the 2 periods. So in both periods, ModivCare and Waldo Cap were under the contractually required 1% missed trips. In Penquist Cap was actually over the contractually required 1% missed trips for that earlier period from a year ago, but they were significantly under the 1% for December 2025. So you're right that the number of missed trips that Penquist had dropped significantly, but as a percentage, and the percentage dropped too. So that does support what you're saying as well. So both the percentages look better as well as the numbers. I don't have an immediate answer as to what changed. There's fluctuation over the course of a year for any and all of the brokers, we can certainly go back and ask some questions and see if there's anything particular to say about why the number is improved, but I don't have that information with me right now.
Yeah, I mean, I recognize that there's going to be some statistical variation going from 1.3% to 0.3%. That is a huge change. And so, you know, and that's good to hear.
Yes.
Would love to know to understand how to substantiate that. What changed? Is that just attributed to statistical variation? You know, a statistician could tell us how likely that is, or was there something that changed? Because we want to believe these good numbers, and I really appreciate you looking into that.
Absolutely.
Representative Lemlin.
Thank you. Who is Medical Transportation Management?
They are the bidder who came in second in the RFP process.
Yes, I realize that. Who are they? Where are they from? Are they currently providing transportation in Maine?
They are not currently a broker in Maine. I would have to get back to the committee with more information about them as an organization.
Okay, because I was under the impression that the only people bidding were people who were already providing transportation in Maine. So that's not true, right?
Correct. That's not true. It was an open procurement process. Anyone could have bid, and MTM did bid, and they placed second. And they are not one of the responders who is appealing. So they have not appealed the fact that they did not win.
Okay, I'd be curious to find out where they are and who they are and all that. If you could get me that information, please.
Sure, we can follow up with that.
Thank you.
Any other questions from the committee? Molly, I just want to go back over the last piece of the memo, the status of the appeal. I just don't think this committee has had a truly robust conversation about where this issue has been legally and where we're currently at. So at two levels, the awarding of the contract to Motive Care by the department was upheld.
That's correct.
And at this point in time, we have 2 appeals to the High Court.
That's correct. Each of the bidders named here has followed their own appeal process. And both the appeals that were upheld as well as the appeal that is taking place now are all on the basis of the process, the procurement process. So did the department appropriately follow the procurement processes as it should have?
And at 2 levels, it was indicated that the process was followed by the department.
That's correct.
Okay. Any other questions from the committee? Seeing none, we're grateful you're here today. Hope you feel better soon.
Thank you. And just to say, I am staying on for the 1835 work session.
Thank
So
you.
I'll leave it up to you if you want to keep me up here or take me off and put me back if you have any questions for me.
Thank you. Appreciate that.
Mhm.
So joining us today as well are some representatives from Motive Care. I think the committee would like to have the benefit of the ability to ask some questions now that you have emerged from bankruptcy. So I would ask 1 or 2 of you to please join us here on mic and introduce yourselves and update the committee on where you're at. You'll need to. There you go. You're on.
Thank you, Chair Meyer. Good morning. I'm Daniel Silvers, Chairman of the Board of Motive Care. Last fall, I had the privilege of attending the Joint Committee on Health and Human Services hearing session along with our CEO, Heath Sampson. Heath sends his regards as he was unable to be here this morning amid the winter weather. We're grateful for the opportunity to stand before the committee once again and remain committed to working collaboratively with this group to deliver on our mission and yours of providing safe, dependable transportation for Maine Care members who rely on these services every day. Thank you for allowing us to be part of this conversation.
Thank you. My name's Edward Hoffman. Thank you for allowing us to be here today. I'm the Senior Vice President of Operations for Motive Care.
Thank you for being here. So you've emerged from bankruptcy. And so I think the committee and those listening in and would appreciate an update on what that means going forward for Motive Care and for the people of Maine, depending on the services you're providing.
Sure. Well, thank you for the question. As you may know, on December 29th, we emerged from bankruptcy protection. And when we were here in September, we talked to this committee about the fact that during our restructuring, there would be no interruption in our operations, no interruption in payments to providers. And I think this is very clearly a case of promises made and promises kept. And actually, in most cases, our operating metrics improved during the fall and into the winter. So we are sitting here today with an incredibly strong financial position and ability to deliver continued uninterrupted service to fulfill our daily mission of getting a vulnerable population of Mainers to their appointments on time and safely. And we're committed to doing that going forward. And we look forward to doing it.
Thank you. I have nothing to add.
Okay. Any questions or comments from the committee at this point? Yes.
Thank you very much for being here and for traveling in the winter weather. Similar question that I asked Ms. Slosnick. Motive Care's complaint rate, I'm sorry, the missed trips dropped by 50% last year. Why?
So the specifics in terms of how we manage our network, how we look at the data, the remediation plans in terms of missed trips, I would have to rely on our local operations team to walk you through the precise mechanics of how we manage service. What I would say is we are constantly looking at the data and taking complaints and missed trips and adjusting our operating cadence with our providers. So we are holding our providers accountable. We're changing their manifests. We're digitally connected to our network so that we can look at where they are, where they've been, and optimize how we're assigning trips or referring trips to our transportation providers. What I would say from a data perspective is that the missed trip percentage is very much consistent with what you see from the complaint rate. We have a very low complaint rate, 0.07, which is less than 1 for every 1,000 trips that we've performed. So those two metrics are very much aligned. We feel like we would see a much higher complaint rate if missed trips were higher. I will also add that we have what we believe is a very generous threshold for complaints, which is any expression of dissatisfaction. So if we get a phone call from a member or somebody representing them, even if it's not technically a complaint or coming into a complaint line, if there's any expression of dissatisfaction in that phone call, it gets registered as a complaint and it goes into our remediation and investigation unit to be remediated.
So thank you. I appreciate that you've got the close watch with the data analytics. Would it be difficult to get the historical data to see what kind of variation there is here?
Would it be okay for us to follow up as a follow-up?
Of course,
Follow-up?
yeah.
Of course,
That's not
yes.
something that I would expect you'd be able to have in your brain right now.
Well, sometimes it depends on the question, but we can walk you through what's changed this year, the decisions we've made, how we've adjusted trips with the partners that we refer. We work very closely. I mean, we've been here for more than 10 years. Our partnerships are very close. We work with them as partners. So we can walk you through the things that we've changed operationally, how we've worked with our transportation partners to achieve these metrics.
Is that something you can do now? Can
In-
you walk us through some of the ways that you have changed the way you were delivering this service? And
we have live dashboards. So one of the advantages that ModivCare has is that we provide what we call ATMS, which is basically trip management software to all of our providers. So we are able to watch how they are performing and have transparency through this digitization into where they are. Do they have too many trips? Are we routing trips inefficiently, meaning we're dragging, vehicles across town when we could be much more efficient? So we have technology that helps us optimize this. And so every single day, we're looking at this performance metrics and making adjustments. And then we work with our providers with regular performance reviews on a daily basis. So we're getting feedback from them on what's working, what's not, members that may not be traveling, appointment times that have been set up that perhaps don't match their actual travel schedule. So this is a constant cycle inside the organization in terms of optimizing how we're providing service. I don't know that I could walk you through right now what we've done, specific to a specific provider in our network. I could get you a plan that sort of walks you through the past year and how we've improved. But from a general standpoint, this is how we operate. We're constantly looking at the data. Our digital connection to providers gives us a lot of insight into what's working and what's not working. And then we're making adjustments, on a daily basis, weekly basis, and through regular meetings with our transportation providers.
Senator.
Thank you so much for being here.
Of course.
I'm going back to the number of complaints, and I
Yes.
realize the number is very, very low.
Yes.
But I get concerned about, have you all established a complaint phone number that we could call, that our constituents can call?
A member care, yes, so we do. So I'd like to begin by saying one complaint is one complaint too many. And we take those very seriously. And that's why we've purposely set the threshold for what a complaint is as low as it is. So it doesn't have to be a formal complaint. It's just any expression of dissatisfaction when we're interacting immediately goes in. And so goes into our remediation process. So every complaint that comes in begins a local representative, a Mainer, is looking at that on day one. Within 5 business days, generally much shorter, we've completed our investigation and we have gotten back with that member or the facility that may be reporting it on their behalf. In addition to that, we are taking the entire complaint and documenting it. We complete our investigation and that is mailed to every member or representative that called us in. This is what the complaint said, top to bottom. Here's what our investigation found, so that we're closing the loop with every member. So if there are specifics about a specific complaint, we are your partner. We would love to know if there's something that you're hearing that we're not. I believe that we've provided a letter or a document that tells you how to refer complaints to us. First of all, make sure that which region is it? Is it our region or is it a Penquist region? Just to make sure that it gets to the right broker to manage. And then we will follow up with you. Again, our complaint percentage is very low. The on-time percentage and the missed trips percentage very much aligned with the amount of complaints that we get.
So as I'm understanding then, Ed, So we would, for example, I'm in Washington County in Hancock.
Yes.
Okay. So I would call my broker direct with a complaint, or I guess that's what I'm asking. What number, how do we tell our constituents what number to call if there's a problem?
So my understanding is that all legislative offices have been provided a toolkit,
Okay.
which
We just haven't
does,
seen it yet.
we can absolutely make sure that
As
that's
the
provided to
committee.
everybody here.
Yeah, as a committee.
So the first point of contact would be the regional broker, but the second point of contact would be Main Care Member Services at 1-800-977-6740. And I would tell each of you and anybody else who's listening, I'm the chair of this company. We have, as chair, my primary duty is of oversight. And if there's any concern whatsoever that there are complaints that are not being registered, I personally want to hear about it because I don't have tolerance for that. And if you guys have concerns about it, then I have concerns about it and I want to know.
Well, and I appreciate that, if you don't mind me making a comment. It's just knowing where to call. I know when I was a cancer patient navigator, it took me a while to develop my little resource book, and I knew who to call with Motive Care when I had a complaint about one of my patients. But I just, right now, as a legislator, I know they were making the toolkit and working on the toolkit. I just don't think we've seen it yet.
Okay.
To be able to distribute that. It may be in our legislative offices, but, my aide doesn't always get the call. I may get a text message, I may get a Facebook message, I may even get a phone call to my home when I finally get home to hear the message.
We agree, having a lot of resources doesn't help if we don't make people aware of them.
Correct.
And so we are committed to making sure that this information is disseminated to each of you and to all of your constituents.
And that is our concern.
It is.
Our concern is that we have had a number of presentations and briefings and certainly bills before us. I assume you were listening in or watching when we had the public hearing on 1835. I think it's 1835. And there were a host of individuals who came with, troubling stories about transportation providers not showing, leaving them in places where they shouldn't be left, being rude, some other accusations. And in fairness, it is not just Motive Care that those complaints are leveled against. Okay, we've got a number of providers, and so it's not always clear what those reports, who those reports are pertaining to, but they are reports nonetheless, and it really doesn't matter to this committee when our constituents are telling us stories that are troubling, dangerous, disturbing, and so one of the concerns that we've shared here is that members simply don't know where to call. They don't know how to get in touch, and simplifying that process and perhaps having some oversight over it, which is part of 1835 that we'll be considering later, an ombudsman, might serve to allay some of our concerns that Mainers are simply confused about where to make a complaint.
We agree, and I would further state, we're incredibly proud of the metrics that we have and the performance that we have. But the truth is that it's a deeply personal thing to the person who's misses a ride. And if it's your parent or your child who missed a ride, it doesn't matter how great the metrics look because it's binary. And if you're left, waiting for a ride, we want to know about it. We want to know if there are complaints out there that we're not hearing about. And we would encourage, there's really an open door policy here. We want to hear about it so we can improve and get these metrics, which are terrific to begin with, even better.
Thank you, Madam Chair. How many of the complaints are repeats? For instance, like somebody might have a very difficult, accessibility, driveway or something. I mean, there could be something that would, there's something systemic about why. So is it that are these unique people? These are complaints, and if they're complaints, not unique people's complaints, how many of those are repeats?
A very small percentage. I don't have the percentage of repeat complaints, but I will explain a little bit how our operations work. There's generally two categories of members that are seeking service. What we call standing orders. These are recurring trips of members that are going to dialysis or substance abuse treatment. Very, very small. So if there's an issue, let's say the first time we set them up, generally we will get that resolved for the next trip.
Mhm.
You tend to see more complaints when it's a first time or one-time user
Mhm.
or member who's using it, because maybe they don't know to go around the side or pick up, or they aren't familiar with the vehicle, or, you know, the misconnection. You can, even on healthcare campuses, you can be in the front and the members on the side entrance. So most of our complaints generally are from infrequent users. It's not necessarily that the transporter did something quote unquote wrong. It's that maybe the last 20 or 30 feet, they had difficulty connecting. So the complaints tend to come much more from people who are infrequent users of the service because they're not accustomed to, you know, they don't know the vehicle to look at, or they don't know the entrance, or perhaps that last 50 feet wasn't connected for them.
Follow?
Yeah.
I fully understand that can happen, you know, I work on a medical campus and I can see that,
Yeah.
that sort of thing in play. What I'm still kind of wrestling with is that just on the testimony list from LD 1835, it's not a random sampling, but there's a lot of people that showed up. We also receive a lot of complaints. So, if the lion's share of the complaints, and you describe casting the net very wide, it doesn't mean that ModivCare did anything wrong. If somebody complains, it could have been that they just weren't picked up, and it could have been because of something that was really, an honest mistake or just circumstances. But if that happened, I would think that person wouldn't show up at a hearing, wouldn't contact their legislator. If it was like, hey, I tried this the first time and they didn't pick me up. And then you described a really forward-leaning system to root out, identify the problems and rectify them.
Yes.
If that person was called by you and said, we didn't, sorry, we missed we got a complaint. You were on the other side of the building and let's fix that for next time. I can't imagine that person would show up at a hearing or call a legislator.
Of course.
And so my assumption is that there's sort of the tip of the iceberg sort of phenomenon, and that there only a subset of the people who are truly affected show up. And so when we qualitatively sort of magnify that, it doesn't fit with the 0.07% complaint rate.
Okay.
And so I'm wrestling with that. I'm not saying that you're lying. I'm just trying to reconcile two things that are hard to kind of both be true at the same time. So there might be a missing piece that I don't understand.
Of course, I think that Dan makes an important point, which is it's very, I think, dissatisfying to talk about this through percentages or through numbers, right? Because these are members that need care, need access to services. And in every case, if there's a missed expectation or a missed trip, that has an acute impact on their life. I mean, these are, this isn't necessarily going to the movies. These people are receiving care. And if there's a missed ride, it's going to impact them in a significant way. We do serve about 200,000 Mainers. So the numbers are very large. It is conceivable that if there was a missed expectation with these missed trips, that has created an acute impact on those members. What I would say is for the frequent users, very low chronic issues with people that regularly depend on our services. I think one of the things as a follow-on that we can do is perhaps break the data out and show sort of what our standing order members, these are the frequent recurring members and show the complaint rates with them, and then show the sort of infrequent or one-time users. If there is any information that you have, and I think that was the purpose of the toolkit, but also, contemplating, an ombudsman. If there is information relative to a missed member, particularly somebody who's having a chronic issue with transportation, we want to know about it. So anything that we can do to get that information and serve that member better, we will take. I think it's a matter of making sure that we're hearing about it as well. Again, we don't want to defend ourselves with large numbers. However, we're serving 200,000 members regularly. And when there is a missed expectation, it creates an acute impact on their lives. And we would expect that they would come and want to have an explanation and some commitment from the organization that it's going to get resolved.
Representative Lemlin.
Thank you. I will tell you from experience, 15 years experience, that these numbers right here, they're fake. They're not even close. They are your numbers. And I'm not saying you're putting down the wrong numbers. You're putting down the right numbers. What the representatives here are trying to explain to you is that they're nowhere near accurate. They're not even in the ballpark. I know this from experience. Nobody knows the number to call. A select few will. What happens is I can name you 100 complaints that I put in to KVCAP. The broker is Penquist. I know for a fact that Penquist knows nothing about those complaints. 100% money back guarantee. So those aren't recorded. And I can guarantee you there's more. What the representatives are trying to explain is not just do they not know who to contact to put the complaint in or to give to their constituents, which is a high number. You don't have those. But not only that, you don't have the numbers at all because most people don't know who to call. And you don't know when you do place a call. Yes, if I make it to the CEO, he's going to record it and he's going to be mad. If I make it to the right line for motive care, they're going to record it properly. No matter how small it is, I think you're sincere. The problem is you don't have the numbers. I know for a fact you don't. What we need to do is fix that. Every single member that uses the transportation system needs to get a certified letter that says, here's the number to call for complaints. And it needs to be a centralized line, not KVCAP, a direct line to a person. That's why I recommended in this committee several times now to Roger Bondison that his department have a number. You'd be blown away if you got the actual numbers. You'd be embarrassed because you're not seeing it. And I can guarantee you this is happening.
Thank you, Representative. Response to that?
It's clear that there is something that needs to be remediated in terms of making sure members know who to call, and that comes in and it gets addressed. So there's complete transparency and awareness. It sounds like there's confusion, there's a lack of information. The members don't have the information that they need. In the contract stipulates that we manage complaints, but we do have agreements in which our term is delegated versus non-delegated. Non-delegated means there's either the health plan is taking the inbound complaint or there's a third party set up. So we operate in agreements in which there is a third party or the health plan themselves are taking in the complaints. So it's certainly not a resistance on our part to a system that would be set up. I think that it would only help us reputationally and also with the members to have greater transparency and have everybody feel comfortable that people are aware of where to take their grievances. That's why we have the team here, is specifically to do that. The referrals of trips are actually the easiest part of the business. Assigning rides or referring rides to providers. The reason we have such a large staff is for this specific activity. If all we were doing were sending rides, we would have, a much smaller team. The team's responsibility is remediating this. So I welcome any suggestions on how we could improve the intake and awareness with members in terms of complaints. We certainly do not want to have, even with a relatively small number of missed expectations and missed rides, we certainly don't benefit from having the community feel like their complaints or their issues aren't being heard. So we welcome the opportunity to partner even more closely on this.
So if we assume or we speculate that the two appeals before the High Court affirm that the procurement process was done properly and that Motive Care is the single provider of transportation, of these transportation services statewide. The number of individuals that you are serving, which is presently 200,000, will increase substantially. And I wonder if you can talk a little bit about what some of the current challenges that you face are. In the past, we've heard workforce can be a challenge, as it is in many other sectors. But we have heard that workforce can be a challenge. Drivers. And I wonder if you can just talk about what some of the current challenges are, what some of the anticipated challenges are. And now that you have emerged, as you say, from bankruptcy in an incredibly strong financial position, how you anticipate improving the system through the use of technology, whether there are any other innovative ways to address a workforce shortage. Is it possible to utilize public transportation in those areas of the state where that might be a possibility?
We would certainly, we leverage public transportation and other programs. Transparently, I would say the challenges, logistic challenges, obviously rural populations are the most challenging to serve simply because of fewer leverageable service providers in those areas. And we have members that are going very long distances, in some cases going out of state for treatment. And what that does is when that vehicle or that solution is sort of tied up for a long time, it prevents you from using those solutions, to serve other members. So what I would say is, there are always challenges in our business. Yes, workforce. Obviously, if you have a provider in your network that's not performing, or let's say there's an accident or they lose their insurance or something like that, bringing in other solutions quickly because, hours go by and a crisis can occur. We don't have months to solve a problem. We have hours to solve a problem. So the amount of services that can be leveraged, particularly when you're dealing with a rural population, is always going to be a challenge. I agree, public transportation can and should be leveraged as much as possible. It also gives flexibility to the member, generally speaking, in terms of how they leverage it. Do they want to leave now? Do they want to leave later? Tends to work. They're aware of how to leverage the service so that misconnection happens less. We've also developed drivers and vehicles ourselves as a way of remediating this. So if there aren't service providers, in the area. We are building sort of a captive network to serve them. We partner with communities. Believe it or not, even people who are of retirement age have proven to be interested resources and sort of provide, not wanting to sort of be a transportation provider as a career, but serving and supporting community members. So we've actually gone to our communities and partnered with people in the communities outside of a traditional commercial service. In the specific regions that you mentioned, our intention isn't to come and necessarily develop something completely new. We will bring in additional resources, but we absolutely intend, and I believe it's part of the award, that we'd be contracting with the current CAPS in those areas. So if members are being served and served successfully and they like their provider, we intend to continue to allow that to happen. But what we want to do is surge resources behind it so that if there are gaps, if there are opportunities, or we need a stronger safety net or recovery network, we can put it in behind it, right? So higher levels of service, rural coverage, very long distance trips. Those are the things that generally make our business challenging. How do you get wheelchair vans and stretcher vehicles and things to very remote areas? When you have to transport somebody out of the state for care, that obviously puts a burden on the amount of capacity that you have to serve them. So I would say that that's going to be evergreen for us. We're always going to have to be solving for that. I think our track record shows, not only in Maine, but in other states, that we've been very successful. I would say of all the things that ModivCare talks about, our network and ability to develop network, I think is sort of unique in our industry, building, a network to support members. We've had, I think we mentioned it earlier, a provider that suddenly went out of business and we were able to surge solutions in right after that. I think that's one of the benefits of working with ModivCare as a broker.
Thank you for Chair's indulgence. You asked earlier for suggestions because it's important to you to miss opportunities to hear about a complaint. I think if I may respond to that request, one way would be to make it as easy to register a complaint as it is to order the service. And through the same medium. If there's an app, then this, a clear button on the app. If it's a phone number to call for a ride, then it's the same phone number to register a complaint. And apparently, it's that the people are trained to say, and if you are unhappy with your service, you can talk to me about. So in other words, lowest barrier possible, I think is probably good practice. I'm not as familiar with the industry as you, but as a consumer of many apps and things where it's pretty easy to register a complaint, some more than others.
Yeah.
And so if I take you at your word, you seem very earnest, and you seem you have to have your customers' interests and your shareholders' interests in mind. That sometimes those are two different masters, but I believe that you believe that. Good service is the best way to run a company, and so that's my suggestion. Since you asked for it, I think making it as easy as possible means that you're least likely to miss opportunities to improve.
Of course, it's coming through very clearly that in terms of capturing complaints, that's an area that we need to be focused on. Is making sure that people have multiple ways and they're aware of how to register their complaint. We do have an app. I think we have over 300,000 users of the app. Making members aware that it exists is, we always want to partner with the community to make sure they know what tools they have. You are able to register a complaint through the app, but it's making sure that the members have it. The other benefit of the app is what I described as that last 50-foot problem, right? maybe if you've used Uber or Lyft or something like that in the airport, you see that your vehicle is maybe 100 feet from you. There's a little blue dot and you can walk towards it. So one of the other advantages of having the app in more people's hand is you solve that last 100-foot problem that can occur, particularly on health system campuses. It's a big issue, right? Making sure the geocoding, not to get into too much technical lingo, but the geocoding that goes into the address, how do you make sure it's at the right door, the right part of the campus? The application helps you with that. So and infrequent users that aren't accustomed to using the service, let's say they're using it for the first time. They don't know what van to look for. They don't have the phone number. They don't have the license plate. Again, having it in the application, they would have all of that information, in a button that they could either call us or they could call the transportation provider directly.
So just to go back to a statement that was made in answer to my question about should the High Court rule in favor of the department's process. And you mentioned that the current CAP agencies that are being managed, the brokers being managed currently by the department, you would contract with. Am I correct?
If I'm not mistaken, that is part of the award, is that we would have earnest, good faith efforts that would include MaineCare in the brokering, and it would be our intention to continue to leverage them so long as the service is being provided and meeting the needs of the member. So it allows us to do our job, right? The things that we think that we're strongest at, building networks, building redundancy, all of these things. But it allows the providers to focus on delivering service. So we think that that's a strong model. I think it's part of the contract, and it would be our intention to do that even if it wasn't part of the contract. Resources are scarce, and you have to build partnerships with the resources that are there. And that's certainly how we've approached it here, and would approach it even if it wasn't a contractual requirement.
Representative.
Thank you. Mike, do you use a computerized system to schedule all the rides?
Yes, we do.
And that is sent to the cell phone that you provide to the volunteer drivers?
Yes. So we have a enterprise system, and part of our solution suite is an application called WellRide, which is, without getting into a lot of detail, it's a trip management platform for service providers. It's the largest user base in the industry, and we give it away to our providers for free so that they can use it, and is fully integrated with our systems. So we are capturing live real-time events such as drivers arrived, drivers left, pick up, all of the events, along with capturing those breadcrumbs. That helps with remediation as well as investigations, what actually happened versus maybe what people said happened. You can look at an objective digital record and make that determination. Additionally, there are providers that use their own software to run their own programs. They don't want to use ours. And we integrate with 40 different systems, which in the industry is I think twice as many as any other competitor. So we have a deep commitment as an organization to being digitally connected to our service providers. And we do use technology and algorithms to constantly optimize how we're referring volume. One way that we can see that we're over assigning volume is if a lot of trips come back saying we can't cover these. And so that constant algorithmic activity helps us optimize how we're referring those trips.
Okay, that was my concern, because I have found that computer system fails a lot because it doesn't take into account delays. It doesn't take into account traffic. It doesn't take into account a lot of effects. And what happens is it all snowballs, as you know.
Right.
And
That's exactly right.
and people are going to be picked up late and be late for their appointments. I mean, it happens to me a lot. And so I'm glad to hear this algorithm redoing, but how often do you do that to try to make sure that this doesn't happen and make it as optimal as possible?
Representative Lemelin, just clarifying, are you talking about in your service area that I think is Penquis, or are you talking about complaints that you've had from others? Just so we answer, so we answer.
Both. Everybody has the same, I get a lot of complaints about this. These aren't major complaints. It's just that snowballing effect, because the computer says, hey, you can pick up this person. It's only going to take 8 minutes, drive to here, et cetera, et cetera. And at first it's deadly accurate, but the snowballing effect does happen. And then after 2 or 3 rides,
You're late for your entire day, is what you're saying.
correct.
Yes.
Or the driver can't pick up 2 or 3 people, like you said, and now you have to. I have a problem with the computer system unless you are correcting it all the time, and this is a concern of mine. That's why I'm asking you how you deal with it.
So I would agree. I mean, it's 2 parts. One is the computer system, and the other is the service network, having enough redundancy built into the network so that if using your example, which is, a perfect one, it snowballs. You're late for an appointment, there's a flat tire, something like that. Now you're behind for the rest of your day. That's why having a robust network helps you, is that you can help that provider recover. So when you're using a solution that only uses their own vehicles, and that's the entirety of the network, when those issues happen, even if you can see it, there's no solution there. So that's why it's really important to have a big network. So when you do identify those problems, there's actually something that you can turn to. And that's why we think that, our model works very well in partnership with the local service providers. We allow them to continue to take the rides and perform the service, but when they do have an issue, we're able to step in and help them recover.
One more thing, and the concern is the same as Representative Meyer had, and that is staffing. Most of the drivers are volunteers. What are you going to do if this goes through and we don't pass a law that says you can't do it? What are you going to do when you take over and there's a lot of drivers that used to work for you that don't want to work for you anymore, but they're working for Penquis and KV Cap, and now you lose 10-20% of your workforce? As it is, there's not enough drivers. KV Cap, I think, lost 25% of their workforce. And they're struggling. It's not their fault. Do you have a plan? Do you have a contingency plan to take over the state of Maine? Because this is a huge thing. And to provide those services, where are you going to get those drivers? I think that's what Representative Meyer was indicating, and I'm concerned also.
So our intention is to partner with the local service providers that are there. So we would start with, what does their capacity look like? Are members being served in the manner that they deserve? And keeping them whole on the service that they can provide at the appropriate level. Then we would be bringing providers in from neighboring regions to expand into these areas to provide service. So that's standard blocking and tackling at ModivCare. We do that routinely. We even bring providers in from out of state to bring in vehicles. And then again, we have our own vehicles and our own community. I don't want to say it's Uber or Lyft, but our way of working with independent drivers as well. So I would say from a the term we use is network adequacy. That's our metric. In terms of missed rides, complaints, all drive that metric. I would say we have the largest toolbox to address the issue that you're describing. The most difficult part is working with a finite group of resources because you have a workforce disruption or vehicles go down or somebody loses their insurance. Let's say there's an accident. If you don't have a safety net, if you don't have a mechanism to surge resources or bring things in, you're really sort of trapped, and you could be trapped for months. These problems can go there. Sometimes there are no really fast solutions. So that we do believe that is why we exist, is to make sure network adequacy is always there, not to displace current service providers, but actually to support them in case there are issues.
1 second before your question. I know I had a list of individuals who were coming from Motive Care. Is Myra
Yeah.
Orifice? Yeah.
Yes.
Could we make room?
Oh, of course. Myra.
Hi. Morning.
Welcome. Just
Thank
wanted to
you.
make sure you were part of the conversation.
Huh?
Please
Oh,
introduce yourself.
Sorry. Myra Orifice. I'm the Senior Director for the operations in the state of Maine.
For Motive Care.
Yes, for Motive Care.
Anything to add to
A
what you've
couple
heard
of-
here, or, yeah?
A couple of things. The gentleman there, what you proposed about the toll-free number that the members call for reservations. Since 2013, there's an option on that toll-free number to reach a live agent to file a complaint. It's actually part of our contract. So we've always done that. The other item that you brought up was, can I go from item to item?
Sure.
Okay. Is about the missed trips from one quarter to another. So Motive Care, in 2025, we added 6 new providers in the regions where we needed coverage. We actually brought in one large provider for Region 2 DCAP because slowly they stopped doing transport. But with 6 providers in an identified area that has missed trips, let's say they have 3 vehicles, each vehicle's daily can cover 10 to 12 trips. So that's where you see, it seems like it was a quick change, but it takes about 3 months to bring a new provider in with the vetting and the compliance inspections. So the change wasn't like really quick, but they were in line in one quarter, and you see the effects of the additional vehicles in that following quarter.
Thank you very much, Ms. Orpis. Is that pronounced correctly?
Myra?
Myra?
Yeah.
Thank you very much, Myra. So if I understand what you're saying, things were going, the baseline is closer to what is reported in December, that there were, 0.09%
Yes.
missed trips. There was some new folks that were brought on, there was a slight worsening, a doubling of but still well below the contractual
Yeah.
threshold, still very much meeting
Yeah.
the standard. And then things got back to.
Right, so if you look at January 2025, the gross trips, and you look at December, throughout the year, we had an increase of 8% of trips, like month over month. So what you're seeing there are trips that don't contain denials or cancellations, but as a whole, that 2025 saw an increase of 8% in gross trips. So it might have gone from 0.07 to 0.09, but our gross trip volume, which is not on your report, also increased month after month.
Okay. Thank you. I think ultimately I'd like to just see the data,
Oh,
it's
yeah.
0.09% and doubling to 0.18%,
Mhm.
still both very good. What I'm hearing is that, that the aberrant, the outlier is the worst one, is what you're saying. and
Right.
the data would help kind of
And
see the
I think
variation.
the biggest effect that Motive Care felt was the loss of DCAP. They were the cap in the region. They received most of the transportation requests. We prioritize the cap as being the one that sees and works the trips first. And they got, during the year, they got to the point where maybe they were doing 100. And then by the end of the year, mid-year, they were doing 3 trips. And it's very costly for a provider, number one, to open an office in that region and to add 15, 20 more vehicles. They have to hire drivers locally too. So all of that takes a very long time. And you'll see a section in our missed trips that were mostly due to DCAP not being able to continue. And
Okay.
it's very far for anybody else to expand, but we were lucky.
Appreciate it. Thank you.
Seeing no other questions, thanks for being here today. We appreciate it.
Thank you for having us.
Thank you very much.
We'll take a 5-minute break and resume. Or let's take a 12-minute break and come back at 11:30. Welcome back. We're going to open up a work session on LD 1835. And I would ask our analyst, Sam Seneft, to begin.
Everyone, so this is the third work session on LD 1835, an act to improve non-emergency main care transportation. At the last work session, you had gone over the provisions that are made in the bill. And I'll just remind you that the bill, as originally drafted, does a number of things. It requires the department to maintain a dashboard on a website reflecting broker performance. It requires the department to track trips by region and issue a monthly report regarding incidents. It establishes an ombudsman program as an independent program to provide ombudsman services to main care members regarding NET. And it requires the department to establish a non-emergency transportation advisory committee in each region. So the committee talked primarily about the ombudsman program during your last conversation, and you had a number of questions about some changes that could be made both to the current system in which brokers are operate, and also kind of what the parameters of an ombudsman program would look like. So you had a number of questions, and I relayed those questions to the department. You have in front of you the answers that the department provided in writing, so I will go over those. And then you can ask me questions, you can ask Abby questions. And the other thing that you have in front of you that I provided, we often get questions about ombudsmen, and I find myself trying to like remember who all the ombuds people are in the state. So I made a list of all the current ombudsman services that I could find in statute, whether they're active. I'll send this to you over email too, so you can have links to everything. Just that might be useful for other reasons. Just to look at what the authority of these ombudsman's offices were and kind of how they varied to give you an idea of what they look like in operation. So I'll start by going through the questions that the department answered for the committee. So there was a proposal put out there that the net contracts be required to be awarded to at least 2 different brokers. So the department in their response cited current procurement law, which requires that contracts be awarded to the best value bidder, taking into consideration the qualities of the goods or services supplied, conformity with specifications, purposes for which they require, date of delivery, and the best interests of the state. So historically, the way that these contract of awards have worked is that the department has chosen the best value bidder in each of the 8 transportation regions. So in their response, they expressed some concern about how that would work if two brokers needed to be chosen from each region. So there might not be bids for each region. You might have people who bidded but didn't score high enough to win the award. And they stated, and I'll quote, "Practically, it's not clear how the department would choose which regions or which clients within a region would be served by the best value bidder and which would be served by the lower value bidder." They also just noted that they couldn't make changes to the current procurement that is currently under litigation, because that would change the terms of the RFP that the bidders responded to. So this would have to be, any changes would need to be at the next 10-year contract. There was also a suggestion to limit net contracts to 5 years. You can read DHHS's response. They had some concern about the upfront preparations and costs that go into these contracts. So they noted that a lot of these costs, equipping call centers, negotiating contracts with nonprofit organizations, technology, these costs aren't covered by upfront by the contract. So they had some concern about contractors wanting to bid for this service without the assurance that they would have long-term that those efforts would be useful in the long term. They noted that it was because of those reasons that DAPS had approved a 10-year contract for net services. They did also note that the contract isn't a single 10-year contract, it's actually two 5-year contracts. And they stated that at the end of each 2-year period, the department has an opportunity to assess performance and other factors to determine whether to renew for another 2 years up to the end of that 10-year period. And they did just remind you again that they couldn't make this change to the current contract that is under litigation. The third suggestion was requiring net brokers to pay for the cost of the proposed ombudsman and tying payments to performance. You can read their response here. They had again some concerns about how they would determine an appropriate dollar amount per violation. They don't have any. There's no models like this that they're aware of, and noted that it would be quite complex to figure out how to implement this. They noted that they would need CMS to weigh in on the model, and they had some concern about disincentivizing smaller nonprofit organizations from competing for net broker contracts, that there would be more of an incentive in this model for larger organizations that could bear those costs to bid. They also said, quote, "It is not clear how we would compel net brokers to pay for the costs of a proposed ombudsman," and had some concern that an ombudsman would not be impartial if it is funded by the organizations that it is meant to oversee. And again, noted that they couldn't make this change until the next contract. So the last issue was about binding authority. So they noted that there is an administrative hearing process in place. They also noted that this could result in legal disputes that would have to be settled by arbitration if you had some binding authority by an ombudsman. And they were concerned that many of the issues that are brought forth as complaints aren't something that could easily be handled in a binding kind of capacity. Like, for example, if there's lack of drivers, like I think they had some concern over how that would be handled by an entity that had the binding authority to make a decision. Like, that entity could say you have to find a driver, but if there's no driver, they had some concerns about that. I would say that in terms of the way that ombudsman services are currently structured within Maine state government, there's a couple ways that we see these structured. Some of them, like as is proposed in the bill, are contracted out services. And I think the best example of that is the long-term care ombudsman, which is quite a large office, actually. There are some smaller ombudsmen, for example, a student loan ombudsman, which is within DPFR, Bureau of Consumer Credit Protection, is actually a state employee who is situated within that department. I think that when you are dealing with an ombudsman that is hearing complaints that are derived from the services that the state is delivering, rather than, for example, a student loan ombudsman who's a little more removed from the thing that is being considered. Having a contract is probably, it seems like that's how those types of services are typically set up. And none of these, as far as I could tell, have any authority to make a binding decision. And by binding, I mean legally binding. That doesn't mean that those decisions don't have a lot of weight, and that if a court were to later look at something that an ombudsman had weighed in on, that the court may well take into account the findings of the ombudsman when they're making their decision. But typically ombudsmen are not, it's not an arbitration, it's not a mediation. It is an entity that does fact finding, brings together both sides and tries to sort out a solution short of a binding legal authority. I hope that's helpful. happy to answer questions if I can, and I'm sure Abby can answer questions from the department. As
Thank you,
well.
Sam. Representative.
Thank you. So you're indicating that even if we passed a law right now that says there has to be 2 or more brokers, this RFP would be grandfathered and it would not have to fall under the law?
So it's because the RFP itself was the people who the entities that responded to the RFP were responding to that document. So they would you'd have to start over essentially. Because they would be bidding on something that is different than what they had agreed to when they submitted their application. So it's the department can't come in now and change the terms of that RFP.
Right. But they would have to start over. If the law happened, let's say we chose to have it 2+ and we make that law, they'd have to redo the RFP. They couldn't just continue with the RFP, correct?
I would defer to the department on that, but my understanding is I think there'd be some legal implications there if the department withdrew at this point, but I would hesitate to comment further on that without, I think that is a question for.
Yeah, I mean, we can certainly follow up on that thread, but I think we also need to be considering the fact that there are 2 appeals on this contract before the High Court here in Maine. And I just, based on the separation of powers, I'm not.
I respect that and I see your point. My concern is that maybe this RFP should have never happened. And maybe it wasn't, that's my concern. And, it's not like they came to us and said, hey, do you think it's a good idea to do this RFP for one?
Understood, Representative, but I think that there is a Supreme Court of the state of Maine who is considering that very issue as we speak.
I'm not sure that's what they're considering. And correct me if I'm wrong, but I think they're considering whether or not the RFP followed standard RFP procedures. That's different from whether or not it should have been done in the first place. That's not for the courts to decide. In my opinion, that's for us to decide.
I'm not sure I agree with the latter part of your statement, but I also think that what you're proposing would throw the entire system into a great deal of instability. And what we're trying to do here is to stabilize it, to ensure that the people that it is serving have a structured, dependable means of weighing in when things are not going well, and that we have an entity in place that can report back to this committee, bring us the data, and help us to refine the delivery of this service. I think that's where our role is. But I'm happy to hear what the rest of the committee is thinking. So Representative Daigle, then Zager.
We have concerns about the reliability of data. And if we could find a way to clarify the fact that the data we do receive is accurate. I'm a data-oriented individual, but if I receive wrong data, I'll never make a right decision. So I would like to find some way, if possible, we could assure that the numbers we get are accurate.
Thank you, Madam Chair. And to go off Representative Daigle's comment, or we previously asked out loud and queried the department about things like an ombudsman. So I'd like to kind of explore that as a committee now to address the concern that Representative Daigle brought up about the reliability of the data. The department, I want to thank the department for these answers. Number 3, was requiring what we wondered about, like the feasibility of, and the sensibility in the department's opinion about requiring non-emergency transport brokers to pay for a proposed ombudsman and potentially tying the payments to performance. I think I have to, that second thing was, I think I had asked out loud and I appreciate the department saying, yeah, that's not such a good idea for these various reasons. And so I accept that. I still think that I don't think I'm alone, that an ombudsman, would be a fair way to make sure that data is reliable, that we have the qualitative as well as the quantitative data, and that they work together. And so I have a question, Sam, about the department did not smile upon even the concept of requiring NET brokers to pay at all for an ombudsman. I'm not sure I'm as convinced by what they said as for the other things about tying it to performance metrics. And so I guess my question is it a conflict of interest for an ombudsman to be paid through some sort of fee or from the, say, mode of care or contractor? Is it a conflict of interest for them to be paid through some sort of fee, but to be responding to the needs of the legislature to understand the data?
I think it's probably a subjective answer. I think it kind of depends who you ask. I don't know that there's anything like objectively hard and fast that says you can't do this. It seems to me like it's a matter of
judgment.
I think Molly Slotnick might still be on the call too. Maybe would have some input.
Was that a yes? Yeah. Molly Slotnick?
Yes, sorry, just getting my video and sound turned back on.
And you've been listening in?
Yes.
On some of the questions?
Mm-hmm.
Yeah.
So the question is about this question of being impartial, whether an ombudsman could be impartial.
Yes.
Yes, it is. It is our view that there could be some conflict of interest there. As Sam said, there are many models of ombudsman offices across the state, and I'm not personally aware of how they are each funded. So I hesitate to give too definitive an answer there. I think it's probably true, as Sam said, it might depend who you ask. So that might be more of a question to look into how are the other ombudsman programs funded. And I'm not sure if there's some other more legal entity that could possibly weigh in there.
Senator.
I have a question too. And Sam, thank you for this ombudsman's list. I mean, this is great because we hear them all over the place and don't realize we know the ones we know that we work with. I did see on the back page, and we were talking about a little bit, where it says MaineCare/CHIP ombudsman, and it has it in statute. And right there, it specifically says regarding Medicaid services provided by the department and the department's office. But it also talks about advising and working towards resolutions of complaints. This is almost the description of what we would expect the ombudsman to do, as transportation is one of the services that we offer for MaineCare folks. So is this no longer an ombudsman in place, or do we have anything on that?
So I believe there's quite a long history on this. And my understanding is that we used to, and then previously that contract had been eliminated. Might ask Molly if she has
I know.
better history on
Molly,
that.
do you have some history on the MaineCare CHIP ombudsman?
I don't have any particular history with me right now. We could go back and look into that. I do want to call out, though, I'm looking back to the letter that we sent to the committee about this bill last spring in response to the bill, and the part about I'm sorry, I'm just reviewing the letter. We do believe that some elements of the ombudsman program as currently written in the bill are redundant of current department activities. So for example, we do have 3 people on our NET team who do address policy and program questions and do take member complaints and work to resolve the member complaints. And as you just heard In the previous discussion, the brokers themselves also take complaints directly and work very hard to resolve complaints. That can be from members, from legislators, from any member of the public. So there's a little bit of lack of clarity for us about where that line is between what the ombudsman program would do as written in the bill versus what our team and the teams of the brokers and our member services are already doing.
I mean, just one second. I mean, I think that's where we're going with the desire for an ombudsman is to take that oversight and that the receipt of complaints and the remediation of complaints out of the hands of the department and the vendor to an entity like an ombudsman. So you're not, the department and motive care isn't, quote, policing itself. Is that not what we're hoping to see an ombudsman do? Is to be a somewhat objective entity that is able to take complaints and provide guidance and interact with the vendor and the department, and then report back to this committee.
I guess what my concern is that we already have a lot of this in place. And granted, I understand it's, with the broker and then it's also with the department. Right now, we all, I think, pretty much agree that the numbers that are being shown as the number of complaints is not accurate. We ourselves know that. But I think rather than going to the expense of that, because that's going to be expensive for us to add an ombudsman. And we don't really have the funding right now. But if we really work hard to hold the broker to the line and say, we want to make sure we have this one number that everybody calls, all the complaints go there, or they go to main care. And the toolkit talks about that. The first contact is the regional broker. That would be making sure that that regional broker is indeed reporting it up the line to motive care to make sure the numbers are accurate on the complaints themselves. I think that's where we should be starting with. I mean, I rather than recreating and coming up with an additional ombudsman and coming up with an expense, that's where I'm really wanting more to make sure the complaints are truly being recorded. That's kind of where I'm coming from.
Representative Daigle?
It sounds like the ombudsman is not a feasible thing the way our laws are written, the way the contract is written. So what do we have for alternatives like Senator Moore is talking about? We find some way where we can get an assurance that the data is correct, that it does go up the line, doesn't stop at the first place to make that first place look good. We want it carried up the line so we know that what we have is complete and accurate. And if we have that data, it would allow us to make correct decisions. Is there a way to do that, Sam?
I guess I also want to just weigh in here that I'm not refuting the numbers. I'm not refuting the data. I'm not with you thinking that we're getting bad data.
I'm not saying bad data. I'm just saying incomplete. That's really what I'm saying. And I'll use that as an example in Michael's case. Michael knows how many times he's called KVCAP regarding the transportation of his son. Now, granted, Penquist is the provider, but that's not being recorded. It's not showing 100 calls from an end. That's the only thing I'm saying. I'm just saying it's not that. I don't think it's complete.
Yeah. And I also think that it's a matter of calls going to a number of different places.
But so if we say, okay, then make the contact be the main care member services.
I think it already is, isn't it?
It is the second,
that's
contact.
So there would be no deviation from the current system.
Correct. We just need to make sure that everything is actually, the complaints are being recorded. I guess that's what I'm. So do we request a quarterly report? Do we request a monthly report? Do we have this dashboard, which I think Motive Care already has started doing in place?
We have a dashboard, correct, Molly?
Yes, it's on our main care website.
And so,
and that was as a result of discussion on this bill last spring. We implemented that. That was the first provision of the bill.
We've got a dashboard if what you're saying is you don't trust the information that's appearing there, then, I mean, I'm not saying that.
Well, and what I'm saying, it's not that I don't trust the information being provided. I just want to make sure it's complete. I guess that's really where I'm at.
Representative Shiguri.
Yeah, I agree with both Senator Moore and Representative Daigle, and I think what you're saying, Madam Chair, that we need to have some sort of, I think we need to have some sort of an independent broker to guarantee that we are getting accurate and complete information. And if the department and the provider are already say they're doing this, first of all, that creates a problem because you have two entities chasing the same thing. And if you could centralize that somehow, and if they're both spending money on it, is there a way we could ask them if they would be willing to, because you can't mess with an existing contract. But if if both parties agree to amending it so that they each put up something, or that the state's general fund and the provider each put up something to create an ombudsman's office, there'd be a central repository. So you don't have the department getting maybe one set of numbers and the provider getting another set, or it being filtered out at the different levels in the provider. I just think one central place is better, and I think we can work out the funding aspects of it, especially if both sides claim that they're doing it already.
I'm with you on the central repository, a place where there is, it is outside of the department. It is outside of Motive Care or whoever the vendor or vendors are, and is widely disseminated to the public, which is an issue that Representative Lemelin brought up during the presentation this morning, that people just don't know where to go with their issues, which Representative Zager was also drilling down on. Who had their hand up? Okay, Representative Zager.
Thank you, Madam Chair. Basically, I just want to endorse, I think, what you're getting at. Like Senator Moore said, like we have these numbers, and like we are all, I think, to varying degrees, wrestling with like, well, what do we do with these numbers, and asking the department to or Motive Care or somebody to like present more numbers won't necessarily give us that reassurance if we have the qualitative information like Representative Lemelin, told of his personal experiences, and others have testified. And so to me, the next step, as you mentioned, Madam Chair, is to change, to get more qualitative information. Somebody or some office, maybe it's just reactivating the current ombudsman under Section 3174, and figure out the funding that we're kind of wrestling with, and we can get maybe legal assessment as to whether that's a conflict of interest or not. But like I think that's a way forward. It would be responsive to our constituents' calls for improvement.
Yeah.
We need to know, is there something to improve? And that to me is a definitive step to assess how confident we can be in the numbers.
Yeah.
Because the numbers are good. I mean, the numbers are really good, but
and to your point earlier this morning, and to the senator's point and Representative Lemelin and Daigle, it doesn't square with some of the rest of what we are hearing out there, because really what we're talking about here is service to our constituents, to the people of Maine, and a very large contract that the taxpayers of Maine are funding. And so we're looking to make sure that the delivery of this service is as good as it can be, and that we are responsive to the fact that we have heard complaints. We have had a whole room full of people here saying it didn't work for me. And we have to respect that. I believe those people have had, they are compelled to come here, compelled to offer testimony. And there's no reason for us to believe that they or Representative Lemelin have not had the issues that they've had. This, I think, we are all circling the desire to have a central, as Representative Shiguri calls it, repository, a place where those same people can contact a non-vendor related, non-department situated entity who can take those calls, remediate, and communicate with the department and the vendor or vendors and this committee. How we pay for that, I don't know right now. It seems to me that it should, if it's going to require CMS to take a look at having a vendor pay for it under some structured, it's going to take a while.
I did just want to bring one thing to your attention about the ombudsman program as it's drafted here. So the way that I read this and the way that most ombudsman programs operate, it wouldn't be like a first line. It wouldn't be where somebody called the first, like when they had some sort of an issue, like they would still call the broker, I think. An ombudsman typically is somebody who deals with somebody who's like, can't get anywhere with the usual kind of, right.
Escalation.
And I would hesitate to, that I believe when somebody calls the broker or the department with a transportation issue, they try to resolve that very quickly. The language around the ombudsman program, like answer inquiries within 10 business days of receipt, like I think that's not going to work for an agency that needs to be very quickly responsive to problems. So as drafted, the way that I read this ombudsman program is it operates kind of like a somebody to go to when your voice isn't being heard elsewhere.
Right. So if we were to make an analogy with, say, the long-term care ombudsman, which is something we're all familiar with, and we have a lot of interface with the long-term care ombudsman, both in this committee and I think individually. Each of us have used Brenda Gallant and her team to resolve problems for our constituents who are either in long-term care or family members are. And generally the calls come into Brenda and her team when the individual has not been successful in raising those concerns with, say, a nursing home where their family is. So what you're saying here, the analogy that you're drawing here is that if I don't get picked up by my ride and if no one shows, if it's a no-show, I've made my arrangements for a ride, I'm not necessarily going to go to an ombudsman. I may go to an ombudsman if I get no response, no positive response and resolution to my problem from the existing call opportunities.
Yep.
It would be repeated issues with a vendor that would then bump into an ombudsman situation where the ombudsman would say, this is something, this person,
Right.
So I don't know that we're completely resolving our problem here of folks not feeling as though they're not getting resolution to a more immediate problem. Thoughts?
I guess I don't, where are you at? But I will say that I feel a little bit more comfortable now knowing that who to call, if I've got a problem with whatever, with services being provided. I think that we need to get that information out. I know at one point in time, we asked the department if they could send a letter out to everyone who's on main care, because that's who's eligible. That's who's the motive care or the contract is being paid for is by main care provider, our main care person. So if we send a letter out to them and said, okay, these are the numbers you call if you are not satisfied or you're not getting the services that you are that's available to you. I think that would be a start. before we go into, any husband.
Is this what you're referring to?
Yes, that
Where-
is.
Where is this coming from?
I actually had that same question. I'm not
Okay,
entirely sure.
So,
because
okay,
I see
okay.
it on the desk, but I don't.
Okay, let me,
Who's generated
I'll
this?
explain a little bit of the background only
Okay.
because Senator Ingersoll.
Ingerson.
Ingerson, I'm sorry. One of our fire chiefs is Ingersoll, so that's where I'm.
That's
getting
okay.
from.
Henry's not
Ingerson.
here to hear that.
Thank you. I'm sorry, Henry, if you are listening. In one of our work sessions or one of our meetings, he requested that a toolkit be made up, a transportation toolkit be made up.
Okay.
So I know that Motive Care worked with the lobbyist to come up and gather this all into one document so that we could provide that to our offices, that they would be able to respond when any of our constituents called in. And of course, my idea is that we would also, each of us have a copy of this and have it handy so that we could do the same.
And have all the entities that are named here had the opportunity to review this?
That was my understanding, and it was signed off by Senator Ingersoll.
Okay.
And this is just a gathering of information and the staff intake and suggested ways of handling escalation, what to collect, and so forth.
Yeah, there's a lot of information in here. I mean, I don't know that I would.
Now, I am not talking about this being sent to our main care. What
Yeah.
I'm saying is that to our main care for non-emergency transportation, if you have a complaint, first contact your regional broker. Here's the list of the brokers and their phone number. And if you don't get any, your second point of contact then would be your main care member services, and here's the number, period. Just so they know who to call. And most of them that are on services that are using the services do know what their regional broker's number is. But if they know that they can also call that number for a complaint, I think it's just informing the communications to informing those that are using it, not this whole document, not
Yep.
at all.
Yes.
Thank you, Madam Chair. I'm curious, I have a question for Molly. Can you speak more about the role of member services, the 3 staff that you have, and what their level of investigation is into the complaints that you're receiving?
Sure. So and I apologize, I'm flipping through some papers here. We have 3 folks who work for the Office of Main Care Services. They're on our non-emergency transportation team, and they are one avenue through which that we receive complaints. So they are not the first line. They, as stated before, ideally, our preference is that members are calling the brokers with complaints. And then if they are not getting the resolution that they feel they should get, then we ask that they call member services, which is a call center that's a different contracted vendor, having nothing to do with the brokers. It's a totally different vendor. And those members, I believe, I'd have to maybe verify this, but I believe that if member services gets calls, then member services will relay those complaints to our Office of Main Care Services team. So I know there's sort of a lot of different teams I'm talking about here. But the member services call centers, I don't believe that they are going back to the brokers directly. I believe they are coming to our internal main care team, and then our internal main care team would then reach out to the member, hear more details about what happened, reach out to the broker, and would essentially try to triangulate to make sure that the member's complaint first is valid, and then if it's valid, is being appropriately resolved by the broker. We actually have a no wrong door approach to receiving complaints. So we can receive complaints from anywhere at any time, and we would take each of those complaints equally seriously. So that could be receiving a complaint, for example, from one of you on the committee coming to us would be equal to receiving a complaint from member services or from anywhere else. And so we take all of those complaints anywhere they come from and make sure through our team that they get routed to the appropriate broker and resolved. So even though we would prefer that for sort of simplicity and making sure everything's being tracked appropriately, we would prefer that the member calls the broker directly. If the member chooses to register their complaint through any one of a number of other venues, those complaints will all make their way back to the broker one way or the other through our team.
Can we get some hard data on how often that's happening and what resolutions like what the outcomes are of those calls? Because I think it would give us a little bit more of a sense of the urgency of the ombudsman.
Sure. I don't know if everybody has it in front of you. I know Representative Ziegler, you mentioned it earlier, the presentation from last May.
Yeah.
For those of you who do have it in front of you, there's a chart there about the number of complaints that come into member services. And we can always share
If I
that
may,
as
just
needed.
for, so everyone has the information, it was in the bill analysis that Sam presented at a previous work session, and it was on, I don't know,
Blue
it says
paper.
page 4, but it's kind of 2/3 of the way back.
Slide
Thank you.
number 6. And what that chart shows is the number of complaints that have come into member services going back a number of years. It does not have calendar year 2025. We don't have that data yet. So once we have that data, we can share it with you. But this would be total number of complaints across all the brokers for the entirety of each calendar year that's shown on this slide. That's just one channel. So I know that doesn't totally answer your question because that doesn't show all the different channels of how complaints could come in. So we can take that back as a question to see what other data we could gather for complaints coming in through various channels, and what data we might have about resolution.
Since we first heard this bill, which seems like a lifetime ago, we have a dashboard set up. We have more regular report backs to this committee. And there are 2 appeals to the High Court. And I wonder if we are, we're just going around in circles here. I wonder if what this committee needs to do is to await the outcome of the 2 appeals to the Maine Supreme Court and come back at this issue, all the while continuing to receive regular updates on how things are happening with the current structure until there is a decision. I've been a strong proponent of the idea of an ombudsman. I am less certain that that is the right way to go at this point. And I am wondering if we might come back at this at another time. Go ahead.
So are you suggesting that we table it for now and have another work session on it?
I'm not. Representative?
I would be more comfortable with that than killing the bill right now. I really am kind of still interested in the idea of doing something, even if it doesn't impact this contract, that we could say going forward, there should be an ombudsman, or that there should be some, I'm not quite ready to say, let's kill it.
We are in a short session and awaiting decisions from the High Court. Representative Lemlin.
I believe we're never going to get to where I want to be on this. I'm not fancy on the ombudsman, just like you, for the reasons, obvious reasons. I don't think it's properly set up yet. And so I agree with you. It's this short session. I don't think we're going to be able to get back to it and cover it in this time period. So I'd be fine to make a motion ought not to pass, and I have no problem with bringing this back up next session. I think it needs to be addressed. I've made it crystal clear my thoughts. I would prefer not having one broker for various reasons. But right now, I do agree with you. We're spinning our wheels, and it's unfortunate that we can't come to a conclusion, but I realize why. It's a complex thing. So I make a motion on not to pass.
There's a motion.
I'll second the motion. The only discussion to that is I don't know whether we should maybe write a letter and request that we get updated information if it's needed. You know, that we write a letter asking for them to continue to give us the information, continue to report to us. This is very important, and we want to make sure that we are still riding herd on that. I don't know if that's Michael.
I agree with the letter. In the letter, I would like personally that the suggestion of a phone number going out to each recipient of main care transportation. This is kind of vague. You know, I would send out the phone numbers for every broker and main care member services to every recipient. I think that's urgent, just so we can get some factual numbers. Maybe we'll find out that it's not as bad as we thought, which is great. But if there is a problem, then when whoever comes back for the next legislature can cover this. So that's my recommendation.
So there's a motion, a second, further discussion?
Thank you very much, Madam Chair. And I think this is a really fruitful discussion. I'd still like the idea of an ombudsman. I'm not opposed to killing the bill, but keeping the issue very much in the purview of the committee. My suggestion to the committee is that we gather information. Maybe, you know, a letter as described by Senator Moore and Representative Lemelins, that's not necessarily a bad idea. But I think another letter or query, I don't know exactly who I would look to Sam to advise, maybe the Attorney General, maybe some sort of legal authority who could advise on the suitability to make sure there's no conflict of interest for, if we were to consider an ombudsman in the future, it would be good to know if we can, how to pay for that and what our options are to pay for it. So I think that might be useful if we were to, information if we were to consider this issue again in another session. As far as what improvements to kind of ask the contractors to implement now, I think a letter like that is sent out with the telephone number is a kind of a flash in the pan thing. I'm not sure that really has the staying power of systemic change or systemic information. What do I mean by that? If I get into an Uber or a taxi cab, like in a taxi, it says, "How's my driving?" Or if you have any complaints, call this number. It's like literally in front of your nose. And on Uber, it's in the app. Register. Do you have a complaint? Like when you have an active ride, it says, you can do it. So it's as easy to get the ride as it is to make a complaint. If Uber sent me a letter saying, if you ever have any complaints, call this number, I may or may not put that in my phone, but that's like now that onus of managing that information is on me, where it really should be right at the point of interaction or at the point of identifying a problem. And so I think if we do the first letter, as Senator Moore described, that was what I would encourage, that we, the kind of change that we would ask be implemented. And my second suggestion, I realize I've been talking a long time, is to get the information about the legal opinion. Thank you for your indulgence, Madam Chair.
Further discussion?
I like Sam's idea. And if we can incorporate something like that into a letter, I would be okay with ought not to pass. A request that they look into doing that.
There's a motion and a second. Ought not to pass with a letter or maybe even two. All in favor? Thank you, team. That was not easy. It's still not easy.
Lots of hard work. I'll draft
So-
that sooner rather than later. so
Yes,
it's
please.
Fresh on your minds.
Yep. Thank you, Molly, for being here today, all day with us. We appreciate it.
Thank you.
So we have, I've got a lot of paper on my desk here. Yeah, we have 3 public hearings, this afternoon. We're gonna, which start at 1, so we will be back at 1. I'm just trying to look for the order that I, wrote them in.
Oh, I don't know if we changed the order.
Yeah, I did. These public hearings will begin with 2144 at 1 o'clock. We're all set, right?
Yeah.
Ready? Good afternoon and welcome back to the Joint Standing Committee on Health and Human Services. This is the afternoon session, and we have three public hearings before us today. LD 2144 followed by LD 2117 and 2134. Purpose of the public hearing is to invite testimony from members of the public regarding proposed legislation before this committee. Committee will hear testimony from people present and on Zoom who wish to speak for, against, or neither for nor against the bills being heard today. With leave of the chair, committee members may ask clarifying questions of the person testifying today. The public hearing is just that, it's for the public. The committee will have time for deliberation and debate at the work session, which will be scheduled on these bills within the next few weeks. I think we'll do introductions again, starting with Representative Daigle.
Good afternoon. I'm Representative Lucian Daigle and I represent House District 1. And welcome.
Hello, good afternoon. My name is Flavia De Brito. I represent House District 64, which is part of Waterville and part of Winslow.
Hello. Hello, everyone. Good afternoon. Nice to see folks here. My name is Sam Zager. I'm honored to represent District 116, which is part of Portland.
Good afternoon. I'm Mary Ann Moore, and I represent Senate District 6, which is all of Washington County, along with 16 communities in eastern Hancock County as well.
Hi, I'm Michael Lemlin. I represent House District 53, which is Chelsea, Randolph, Pittston, and Dresden.
Hi, I'm Representative Dan Shigori, and I represent House District 55, the communities of Hallwell, Manchester, and West Gardner. And I am very glad that the cafeteria downstairs is serving chicken tenders again.
Good afternoon. My name is Julie McCabe. I represent District 93, part of Lewiston.
I'm Senator Henry Ingwerson. I represent Senate District 32, which is the city of Biddeford and the towns of Arundel, Dayton, Hollis, and Lyman. And I'm pleased to be the Senate Chair of this committee.
And I'm Representative Michelle Meyer, serving Southern Maine's District 150, which is all of Elliott, where I live, and parts of Kittery and South Berwick. And I am pleased and honored to serve as this committee's House Chair. Yes, we have Representative Griffin on Zoom. Would you please introduce yourself, Abby?
Thank you so much. Good afternoon, everyone. My name is Abigail Griffin. I represent House District 34, which is Glenburn, Levant, and Condescag.
And we are joined, as always, by our nonpartisan staff, Anna Broom, to my right from the Office of Policy and Legal Analysis, and our very capable clerk, Sophie Dubé. We will take testimony from people in the room and on Zoom in the following order: those in support of the bill, those opposed, and those neither for nor against, but with additional information for the committee to consider. This committee gives members of the public priority when taking testimony. Only the bill's sponsor and co-sponsors will be recognized before the public is recognized. We run a 3-minute clock. You will see the clock on the front of the horseshoe. As you're approaching the 3-minute point, please wrap up your testimony. For those of you who are on Zoom, I will give you a gentle nudge as you reach 3 minutes. It's running for you as well. If you have prepared testimony, please provide 20 copies to our clerk. You may leave those copies at the end of the horseshoe next to Representative Lemelin. Please sign in at the podium. And we thank you for joining us today. So with that, we will open up the public hearing on LD 2144 and welcome its sponsor, our own Senator Henry Ingwerson. Welcome.
Welcome. That's good to be here. Good afternoon, y'all. Representative Meyer, fellow colleagues of the esteemed Health and Human Services Committee. As you know, I'm Senator Henry Ingwerson, and I represent Senate District 32, which includes Arundel, Biddeford, Dayton, Hollis, and Lyman. Today, I'm very pleased to present my bill LD 2144, resolved to establish a working group to prioritize wellness and mental health resources for our heritage industries. As the Senate Chair of this committee, and also as a member of Agriculture, Conservation, and Forestry Committee, I've had a front row seat to the ways health intersects with our heritage industries. Outside the State House, I have a deep personal experience with agriculture. In my younger years, I built a log cabin and I worked on a farm for decades. Over time, I developed close, strong relationships, family, friends, neighbors, who all drove tractors and labored in the fields. It taught me lessons, some harder than others, that have stayed with me for a lifetime. These days, I still live on an old family farm where I engage in beekeeping and growing vegetables. I strive to plant the seeds for an interest in this important work in my grandkids who, sooner than I care to admit, will become the next generation of leaders and workers responsible for feeding people and taking care of the earth, hopefully in this great state of Maine. Mine is a very part-time, small-scale vocation, but I know how to get my hands in the dirt and grow fresh produce. Even without these experiences, you and I know that farming, fishing, and logging are physically demanding industries. But in general, there is a less awareness of the significant mental strain on these workers, which leads to burnout, stress, or worse. It is critical that we take care of the people who help us put food on the table, provide the material to build our homes, power our economy, and steward our natural resources. As proposed, this bill, LD 2144, would create a working group to convene and work on policy recommendations to address the mental health needs of Maine's workers in heritage industries. It builds on conversations I've been engaged with since last September. In September, I was able to attend and speak at Maine's first ever Land and Sea Farmer Wellness Forum, which was rooted in the ongoing work of the University of Maine Cooperative Extension. Recently, the Extension conducted a survey revealing that 61% of respondents from agriculture, aquaculture, and wild harvest fisheries identified the need for increased public education to raise awareness and reduce stigma around mental health. Suicide rates remain alarmingly high for agriculture, fishing, and forestry occupation groups. I suspect that some of the contributing factors could be rural health deserts, lack of mental health support, and the stigma that holds people in very independent industries back from seeking help. And of course, many farmers and fishermen have no employer-provided health insurance, and that's not getting any better. I'm hoping that the proposed working group can take a closer look at all these factors and others. Reflecting on these sobering statistics, I simply cannot sit back and do nothing while these men and women suffer in silence. When they hurt, their families hurt too. With LD 2144, we have a real opportunity to help. Whether you work in the field or forest or on a boat, you deserve the same compassion and comprehensive mental health care as anyone else. And I thank this committee for its time, and I'd be happy to answer any questions. Also, there's others going to be following me with more detailed testimony.
Thank you, Senator. Questions from the committee? Seeing none.
Thank you.
Co-sponsors in the room. Welcome.
Thank you. Sorry, like looking through two, okay. So good afternoon, Senator Ingwersen, Representative Meyer, and distinguished members of the Health and Human Services Committee. I am Representative Tiffany Strout from Harrington, representing the towns of Millbridge, Harrington, Columbia, Columbia Falls, Centerville, Addison, Jonesport, Beals, Jonesboro, Roque Bluffs, Whitneyville, and Machias in beautiful Washington County, and I'm here today to express my support for LD 2144, resolved to establish the working group to prioritize wellness and mental health resources for heritage industries. Growing up in Down East Maine, I have witnessed firsthand the importance of heritage industries. In fact, they are what keeps Washington County going seasonally. I grew up knowing when one season ended, you prepared for the next. Summer was harvesting blueberries in gardens. In the mid-fall, after the first cold snap, you would harvest brush and make wreaths, and people would move to the woods to gather firewood for the following year or truck logs to mills for processing. Clammers were on the shores year-round if it wasn't too hot on the flats or covered with ice. Fishermen followed various species to harvest, which included lobsters, crabs, shrimp, and groundfish. Heritage industries have been and remain the fiber of our communities. Here are just a few examples of the impacts. In January of 2023, the Seafood Economic Accelerator, or SEA Maine, published the Economic Impacts of Maine Seafood Sector report from data collected in 2019. The report shows the impact of industry cost coastwide, but specifically focusing on my area. The report showed the industry was contributing over $960 million in economic output, which is 14% of our total economic output. This industry supports over 10,900 jobs, which is estimated to contribute roughly 2/3 of our total labor income. The Down East seafood sector supports considerably more jobs than Southern Maine, despite having less than 1/5 of the population. Down East is the wild blueberry capital of the world, even though wild blueberries can be grown in other parts of the state. A study done in 2009 by the University of Maine Cooperative shows the wild blueberry industry contributes approximately $63 million in personal income contributes to approximately 2,540 jobs that are 300 about year-round, and it helps the income of the Passamaquoddy tribes who still own and process blueberry fields. Wood harvesting and wreath making are two industries that are harder to quantify the impact because in both industries, you're able to do them as self-employed individuals. You can harvest your own timber for their own use or as firewood or ship to mills for processing. The same is true for wreath making. You can harvest your own brush and make your own wreaths to share with your friends and neighbors or sell on the internet. There are, however, two big contributors to the industry in Washington County. Woodland Pulp LCC, which is the largest year-round employer in Washington County, and Worcester Holdings, which ships wreaths and balsam products, as well as has the contract for Wreaths Across America, who placed over 3.1 million wreaths on veterans' graves in 2025. You may be asking yourself, what does this information have to do with this bill? I would say everything. The heritage industries are Maine. These jobs are all physical, manual labor careers. The people that work in them are not just doing a job, but rather carrying on a tradition and pride in contributing to their communities. They create a work ethic where you want to continue to do well and provide for your family and community. With the seasonal changes and the uncertainties, there comes a lot of stress and sometimes less time to think about yourself, your health, or the impact your time away and stress has on your family. With heritage industries, there are no breaks. You're always thinking about the next haul, the weather, the cost, and the regulations. You're always living in the unexpected and a wait-and-see environment. Your livelihood is determined mostly by people who have never done your work and have no idea how much you care for the industry and the personal investment you must make to be sure you're not only able to be successful, but future generations are as well. All these uncertainties and pressures will sometimes take a toll on a person's mental health. In my opinion, there are two major contributors impacting mental health in the heritage industries: Mother Nature and government. The world is ever evolving and changing. Changes in climate will always be unpredictable, and humans can have little impact on how it changes, but those in the industry can learn how to work with changes as they have for more than 100 years. The government, however, is something that is more unpredictable and more impactful on the industries. Regulations and law changes could come at the change of administration or the push for a political agenda. Some environmental measures seem to be helpful, but they may actually cause more long-term damage. What really becomes difficult is when you must deal with natural and governmental changes at the same time. You may be thinking this is great for a working group to discuss, and I hope that these are some topics that are discussed. But I think to have a successful working group, education about some of the mental health creation and why is the need for this important information. Mental health has unfortunately become something that people do not want to talk about or seek help for the treatment. There are many things that play into mental health, including funding to make sure people have equal access to services. Working in an ever-changing environment and seasonal industries that you take on the responsibility for many things, and sometimes you, the person, become the last priority. When people are working for you, you also want to make sure their families are cared for, as an example. As I mentioned above, I know a little about these industries. I grew up watching my great-grandparents run a crew of blueberry rakers and then began raking when I was 9. I made wreaths in high school, and now my husband is a subcontractor to harvest blueberries, and my son is a first-generation lobsterman. I can speak firsthand to the stress my family sees from a too rainy May when the bees are not able to pollinate to a drought in August causing berries to dry up and not be able to be harvested, to government regulations on traps and gear and tariffs on needed equipment for the harvesters that you can only get in Canada. As a mom, I've watched my son learn the industry and work his best to make a living. I see him struggle with the uncertainty of future regulations and the possible ramifications if he has to modify his gear after everything is set for the season, or considers if the government will be implementing something that makes the job more dangerous, like weak links in the rope that snap when hauling. One of the major mental health crises recently in my community has been the death of 5 fishermen in 3 years, 4 in 2025 alone. These losses affect both the entire local and wider communities. These communities can relate to what it feels like to losing a son, husband, brother, or father. Mental health cannot be solved in one bill or one working group. It extends through many jobs, roles, education, and commitment, but those who want to help and those who need the help. In closing, I hope this bill will do more than just look at a financial way to help those struggling. My hope is that those on this working group will really take a look at the industry pressures created by the outside influences, the opportunity to educate people on how important these industries are, not only to the economy, but the mental health of so many who want their heritage to continue, so they can share stories about their families for generations to come after them and start to break down the negative stigma associated with seeking mental health assistance. Thank you for your time today, and I would be happy to answer any questions.
Thank you, Representative. Questions from the committee? I'm seeing none.
Thank you for indulging me in the long history of the heritage industry. It's just really important to understand the impact that comes from the area that's dependent upon it, and ways that it's hard to reach out for help and support when you're so, focused on making sure that your industry continues. So thank you.
Understood. We appreciate it.
Thank you.
Any other? Yes, I see a co-sponsor.
Oh, I was like, I can keep talking. Yes, she can.
You'll notice that although I had indicated we run a 3-minute clock, we do not on legislators, and out of respect for the department when they come before us.
Okay,
Welcome.
thank you. So good afternoon, Senator Ingwerson, Representative Meyer, and members of the Health and Human Services Committee. I'm Allison Hepler, and I represent the towns of Aroustic, Georgetown, Phippsburg, West Bath, and Woolwich. And I'm here today to speak in support of the Resolve LD 2144. I'm also going to speak a little about the history of the heritage industry, but as a historian, not as a mom. So bear with me. So like I said, I support the bill from a variety of different angles. As a historian, as a representative of several coastal communities, and as a member or former member of 3 of our natural resources legislative committees. This is what I am not, an expert on wellness or mental health. Fortunately, you'll hear from many who are, or from testimony that's submitted online, which I urge you to read. I taught Maine history for many years at the University of Maine at Farmington, and one of the facets of Maine history that stands out is its resource-based economy. Working in the woods, farming, and fishing predate the arrival of Europeans to these shores. Today, I don't need to tell you how important these industries are to Maine's livelihood and identity. When your workplace is outside and the resource you're exploiting depends on the natural elements, here's a few things to keep in mind. Too much water or water at the wrong time, too much heat and sunshine or not enough at the right time, accessing the resource at the right time and finding enough of it to make a living are all vital considerations. To state the obvious, to a large extent, you are at the mercy of the weather. So why do it? Especially in the farming and fishing industries, it's the independence. It's the ability to make a living on your own schedule, and not punching a clock. You are your own boss. You get to be outside in this beautiful state and engage in nature on a regular basis. The challenges: Being your own boss requires a lot of decision making, and in the case of fishing, those decisions can be life or death. Can I make it out there and haul traps and get back, or should I stay and fix my wonky electronic winch, or patch my questionable boots or foul weather gear? How bad will that storm be? How much do I need to make in order to make my mortgage this month? Finally, the flip side of independence that is so appealing is also that it's a solitary activity. For farmers, both the appeal and the challenges are much the same. They also face market forces they cannot control. In our Agriculture, Conservation, and Forestry Committee, for instance, we watch dairy farmers struggle to care for their animals while trying to make a living for their family. And then, as Representative Strout mentioned, national and international decisions might make you simply throw away your business plan. In the marine fisheries world, we see the same uncertainty with a large amount of federal regulations. While many in these industries face financial, family, and health decisions similar to many of us not in those industries, those in our resource committees often face them alone. And let's face it, the independence of this work, which is part of its appeal, also brings pride. And pride can bring a reluctance to reach out for help. And on my way up here this afternoon, I can't remember what show it was on the radio, but it was a piece on mental health in farmers here in Ohio. And the rest of the Midwest. I can't remember the name of the show, but I can get it for you because I urge you to listen to it. And the way that that state has chosen to respond to it. And so like Representative Strout mentioned, help exists in this state. There are amazing nonprofits and community agencies who are so valuable in helping our communities thrive. Many are here today. So what's the value of this resolve? What can the state do? This working group with input from these organizations can collect data to identify gaps in what's already happening, look out at different states to see how others are responding to this. It's not the time to reinvent the wheel. This working group can identify sustainable funding sources and should provide opportunities for public education, as Representative Strout mentioned. We all know that a stigma still exists around mental health. Let's break that. Let's acknowledge the very real challenges of those who put food on our table and those who source the materials to provide our shelter. Thank you for your time, and I'm happy to answer any questions.
Thank you, Representative Hepler. Questions? Yes, Representative Daigle.
I don't have a question, but I'd like to make a comment if that's okay. I grew up on a potato farm, so I understand that part of our resources. My wife's father grew up in Allagash being a wood harvester, and he went through the whole gamut. And I am very well aware of the challenges that they face. So thank you for this.
Any other questions? Seeing none. Thanks for being here. Any other co-sponsors? So we'll start with testimony in support here in the room.
Good afternoon, Senator Ingerson, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services. My name is Jennifer Thompson, and I serve as the Executive Director of NAMI Maine, the state's largest grassroots mental health organization. Thank you for the opportunity to testify in strong support of LD 2144, resolved to establish the working group to prioritize wellness and mental health resources for the heritage industries. Maine is facing a growing mental health crisis. More than 268,000 adults in our state alone live with mental health conditions. Over 51,000 Mainers experience serious thoughts of suicide each year. And in 2022 alone, 268 lives were lost to suicide. At the same time, more than 260,000 Mainers live in areas with insufficient access to mental health professionals. These numbers are alarming. But for workers in Maine's heritage industries, the risks are even greater. Fishing, forestry, and farming workers face unique stressors: physical danger, financial unpredictability, long hours, isolation, and time spent away from family. These factors, combined with the deeply rooted culture of self-reliance, often lead to mental health needs going unspoken, untreated, and the stigma that's attached to it. At NAMI Maine, we work directly with individuals and families across all of these industries. And what we hear is very clear. People want help, but they want it to be practical, respectful, and build around the realities of their lives. They do not want to be told what they need. They want a voice in shaping the solutions and be part of the future. LD 2144 creates that opportunity. This working group would bring together heritage industry representatives, state agencies, health professionals, and community partners to identify these service gaps, coordinate resources, and develop actionable recommendations that are grounded in Maine's lived experience. This is not about generating another report. It's about building smarter and more responsive systems. NAMI Maine believes that mental health is workforce health, mental health is family health, and mental health is economic health. When we protect the well-being of Maine heritage workers, we protect the foundation of our state. NAMI Maine strongly urges the committee to support LD 2144 and move this resolve forward. In doing so, you send a powerful message that Mainers and the heritage industry workers are not invisible in our mental health system. They're essential to it. Thank you for your time, your leadership, and your commitment to the people of Maine.
Thank you for being here today. Questions for Ms. Thompson? I'm seeing none. Testimony and support.
Good afternoon.
Welcome.
Senator Ingwerson, Representative Meyer, and members of the Health and Human Services Committee. My name is Emily Horton. I'm the Director of Policy at the Department of Agriculture, Conservation, and Forestry. This is my first time in HHS, so. Last week, I spoke with a farmer facing compounding challenges. He had lost one of his major markets, and his crop this summer was severely impacted by ongoing drought. On top of all of this, there were significant losses from winter storms in 2023 and 2024. He's unable to take on any additional debt, and in addition to connecting him with resources DACF could offer, including grants and technical assistance, I shared our mental health resource page. However, I left the conversation feeling like it wasn't enough. We can and should do more. Maine heritage industries, agriculture, forestry, and logging and fishing are the backbone of our state's economy and culture, yet the individuals and families who sustain these industries face extraordinary and often overlooked physical and mental health challenges. I won't speak about the data because Senator Ingwerson already spoke about the cooperative extension report this fall. But this is not a minor concern. These industries consistently rank among occupations with the highest suicide rate in the nation. The Maine's first Land and Sea Farmer Wellness Forum this past September demonstrates that agriculture and natural resource communities see the need for support and attention on these issues of mental health and wellness in our heritage industries. The working group will do a number of things: review and strengthen existing healthcare resources, identify gaps in service delivery, learn from proven successful models, develop sustainable and dedicating funding, or look into develop and sustainable funding mechanisms, and help reduce stigma through targeted public education. As one of the three co-chairing agencies, the Department of Agriculture, Conservation, and Forestry is firmly committed to this work, and it's my understanding that HHS and DMR have also submitted letters of support. We are committed to working alongside all of you in the legislature and moving this forward, and we would strongly support you to support this resolve. I also handed out some cards that we put together. The agricultural trade show took place a couple weeks ago, and for the first time ever, we are starting to have more of this conversation. We had a panel, a well-attended panel conversation with many of the folks in the room talking about this. We've put together these handouts just as quick kind of pocket cards for people to have access to resources. And I can also say I spoke in front of the committee during the budget process almost a year ago, just personally. I had a brother, he was a dairy farmer who died by suicide less than 18 months ago. So while the department obviously sees the value of this, in this work moving forward, I'm certainly bringing lived experience and working through the healthcare gaps and the specific needs of, all the people that are working through this. So thank you.
Well, thank you for being here, and condolences on the tragic loss of your brother.
Thank you.
Questions from the committee? Yes.
Thank you, Madam Chair. Also extend condolences back to your family.
Thank you.
Director, huge amount of mental health care is delivered in primary care offices.
Mhm.
And there's a pretty well documented um, gap in accessibility to primary care in
Mhm.
many of the rural heritage industry parts of the state.
Mhm.
Any thoughts about including in the from the department's perspective, including in the duties section, a look also at that aspect of, you know, of mental health care system?
Specifically to primary care?
Yes.
I
Mental
I
health
would
care delivered through the primary
Yeah,
care system.
that's a great question. I think we should have all of this as part of the conversation. I don't think there's one easy, simple fix. So looking at current gaps and needs and resources, and hopefully the folks that we bring to the table will have some of that background knowledge. But I do think, you know, we've heard a little bit just about trust and environment. And I think with Heritage Industries, this trust of knowing your provider, knowing the people to reach out to is really, really important. And environment in terms of meeting people where they are, that's not always at the primary care office, you know, it's on the farm.
Yep. Appreciate it. Thank you.
Your first visit to HHS, but hopefully not your last. Thanks for being
Thank
here
you.
today.
Yeah.
Testimony and support.
Like Emily, this is my first time in HHS
Well,
as well.
welcome. Glad to have you.
You
like it so far?
Yeah. Senator Ingwersen, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services. My name is Ben Grant, and I am the Deputy Executive Director of Legislative and Public Affairs for the Professional Logging Contractors of the Northeast. We are an educational nonprofit organization that represents over 200 loggers and forest trucking contractors and 125 affiliated members in the state of Maine. I'm presenting testimony on behalf of our Executive Director, Dana Duran. I want to thank Senator Ingwersen and the other co-sponsors for bringing LD 2144 for the session. Logging and truck driving have been deemed by the U.S. Department of Labor as two of the most dangerous jobs in the United States. Our membership takes this very seriously, as accidents and downtime can have a direct impact on their productivity and profitability. The workforce in this industry also faces unique challenges, such as working in isolation in some of the most remote parts of Maine, high-risk work environments such as winter operations, and economic pressures that can take a toll on mental and physical health of owners and their employees. Addressing these issues are critical to sustaining the heritage industry and protecting the people doing the work in our forests. In 2000, the PLC created a partnership with Acadia Insurance to create a culture of safety within our membership because the threat of risk was at an all-time high. In 2010, we took it a step further by offering safety trainings to our members throughout the state and over safety trainings during mud season. This year, we will be offering 12 safety trainings to our members throughout the state and over 1,000 of their employees. Topics for these trainings include first aid, CPR, health for the long haul, stop the bleed, mental health, liability of driving, and what to do after an accident. Training on these topics will assist our membership in understanding how critical these areas are to individual safety and the general public. The PLC recognized an opportunity to prioritize mental health and wellness education into our annual safety spring trainings about 5 years ago. First, we began working with Loggability at the University of Maine Cooperative Extension. Our work with Loggability has been focused on ergonomics, musculoskeletal concerns with classes that teach proper techniques for general wellness, such as stretching, strap throwing, and how to fall safely. These trainings have been well received and demonstrate the need for continued focus on wellness and mental health resources tailored specifically for loggers. For the past 3 years, our organization has teamed up with NAMI Maine to integrate mental health awareness into our spring trainings with a very positive response. These sessions have included classes such as personal mental health, don't stress me, bro, not about you, bro. However, the safety trainings, safety and training is expensive, and contractors are finding it harder and harder to keep up with market stresses as well as changes to the workplace to ensure their employees are safe and also have time and resources for training. As a result, we strongly support LD 2144 and feel it is an important step forward to casting a light on the industry and working to provide resources for our members and their employees. With that said, we do respectfully request an amendment to the proposed stakeholder group membership. The current language includes a seat for one member representing state forestry and logging sector. We believe strongly that, similar to the positions for agriculture and fishing, the focus of this group should be on the practitioners, regardless of industry. Therefore, we would like to see that be logging instead of forestry and logging. Thank you for time. I know my time's up. We urge you to support LD 2144.
Thank you. Thank you for being here. Questions from the committee? I'm seeing none.
Thanks.
Testimony in support in the room.
Not my first time. Chair Ingersoll, Chair Meyer, and members of the Health and Human Services Committee. My name is Bob Staples. I'm the president of the Brett M. Staples Brain Disorder Awareness Coalition, and I'm here today in support of LD 2144. Maine's heritage industries, agriculture, fishing, forestry, and logging are not just jobs. They are identities, family legacies, and ways of life. And for far too long, the brain health realities facing the people who sustain these industries has been treated as invisible or simply part of the job. This resolve matters because it acknowledges something critical. Stress, burnout, depression, anxiety, and suicide are not personal failures. They are predictable outcomes when high-risk work meets isolation, financial pressure, physical danger, and limited access to brain health care. The data cited in this bill confirms what families already know. Suicide rates remain higher in these occupations. Access to culturally competent, industry-specific brain health care remains limited. And stigma, especially in rural and working communities, still keeps people silent until crisis hits. What LD 2144 does right is start with listening. A working group that includes industry voices, rural health expertise, occupational safety, and brain health providers is not bureaucracy. It's how you build solutions that actually work on the ground. Maine does not need one-size-fits-all programs copied from urban settings. It needs approaches that respect independence, privacy, seasonal realities, and the very real fear of being labeled unfit if someone speaks up. I especially appreciate that this resolve looks beyond services alone and includes public education and stigma reduction. You cannot expand access if people are afraid to use it. I would encourage the committee as this work moves forward to ensure a working group also considers individuals living with serious brain disorders within these industries and families impacted by untreated or unrecognized conditions. Wellness conversations must include both prevention and crisis realities, because both exist side by side in Maine's working communities. LD 2144 does not spend money today. It does something just as important. It lays the foundation for smart, sustainable, evidence-based brain health policy tomorrow. Our heritage industries have fed this state, built this state, and defined this state. The people who carried that weight deserve brain health systems that recognize the reality, not as an afterthought, but as a priority. I respectfully urge the committee to support LD 2144. Thank you for your time and for your service to the people of Maine.
Thank you, Mr. Staples. Questions? Seeing none. Testimony in support in the room? You have copies, Bob?
No. Senator Ingerson, Representative Meyer, other distinguished members of the Health and Human Services Committee. I'm here today testifying as John Nutting, a former dairy farmer for 44 years. And I don't know how many times my wife Sandy took my picture as I'm walking up the driveway towards our mailbox to check the mail on a Sunday, because I had no idea what day of the week it was, because you're going that hard, and that's the way it is if you're farming. Several days in a row of haying or chopping or gussying up the cows for their classifications, consecutive 16-hour days, day after day, exhaustion, and maybe losing thousands of dollars worth of hay because the weather forecast had changed and the rain had leached the protein out of it, or losing a premature calf. So many people say, oh, that's a beautiful farm, and it does have a lot of beauty, but it also has a high level of stress. Exhaustion and financial stress can combine to be overwhelming. I'm going to take you very quickly through one day. I had a friend come out to help me with these issues. We opened the door at 4:50 in the morning to have the cows come in from pasture. The sun was coming up. The cows are coming out of the fog that was on the night pasture. You could listen to the water going through the Dead River Dam gates. And also the friend noticed the cat that we had on the farm that always came in after the last cow. She thought she was part dog, I think. And you think, wow, what a great start to the day. You realize that one of your cows couldn't eat or drink that morning, though, because her nose, mouth, and tongue were full of porcupine quills because she wouldn't leave the porcupine alone. So you have the vet come, put her out for a couple hours. You're pulling out the quills with pliers. You're feeling for the quills, so you're bleeding, and you're getting a good mixture of the cow's blood and your blood together to get her back on the road. So we hayed late that day because the weather was changing. We entered the barn to milk at 6:15 that night, and you could not hear yourself think because the normal milking time is 5. And they have a biological clock, a daily clock in them. They expect the same thing every day, day after day, which is great for them. It's hard on people. And so she got me to talk about some of we exported genetics to 31 foreign countries in 44 years, and got me talking about my favorite export, which is a group of Taiwanese farmers. One suggestion: I don't see the farmers, fishermen, and foresters driving an hour to the big city to sit in a sterile room and receive counseling. I just don't. I see some type of a mobile unit bringing the care to them, or to meetings they attend, or something like that. Yeah. So I'm very glad this bill is put in, and I hope it receives your support. Happy to answer any questions.
Thank you, John. Questions from the committee?
Thanks.
Appreciate you being here. Testimony and support in the room?
I too am a Health and Human Services rookie.
Welcome. We're glad you're here.
You're my favorite so far. Chair Ingerson, Chair Meyer, and esteemed members of the Committee on Health and Human Services, my name is Jenny Tilton Flood, and I am an owner and manager at Flood Brothers LLC, a family dairy farm in Clinton. Our multi-generational farm is currently operated and owned by 4 generations of our family, comprised of 17 family members and 6 households. Along with the skills and expertise of 44 team members, 2,200 cows of our herd are milked every day, producing 18,000 gallons of milk for our neighbors' tables. We steward thousands of acres of land, both owned and rented, in 3 counties, including the original farm, which has been situated along the banks of the Kennebec
and in the family for over 2 centuries. Our farm, like the broader food system and agricultural and heritage industries of this state, truly affect the triple bottom line of sustainability here in Maine, the community, the environment, and the economy. Because of all this, it is important to our business, the food system, and my family that the people who power these heritage industries are cared for and invested in through meaningful and impactful policies and programs. LD 2144 is that meaningful and impactful pathway to those programs and policies that support and provide care, and I urge you to vote ought to pass. I'm a dairy farmer, a mother, and a former John Deere parts girl. Every aspect of my way of life and the ways I've made a living has and is about caring for animals and people. And like many in rural communities and in heritage industries, that care is often provided in lonely settings that are isolated, burdened by economic hardship, and involve carrying the heavy baggage of guilt and stubbornness that is in no way a way to empower us to overcome stigma and distance and barriers to not just seeking care, but to accepting it. This working group would lay bare the needs and the limitations of the resources that were never designed to meet the needs of heritage industries and gather the needed information to provide working solutions to the folks that make Maine work. You'll notice I'm skipping around because I'm not able to speak words. I think back to the sound of the bullets being removed from the chamber and put in my outstretched hand. I think back to the day I climbed up into the tractor to sit in the buddy seat to convince someone that they really were needed here for all the tomorrows, and I knew what they were planning. I think back to the frantic calls and communications from all over the country, from people who were scared and did not know what to do about the farmer who had posted a goodbye and no one could reach them. But I am thankful that in each of those instances, I had access to a framework to rely upon, whether it be QPR suicide prevention training, programs in other states such as New York Net, or the resources stood up by my farmer-owned cooperative when they were no longer willing to sit by and see another farmer take their life. I think of all of this, and I truly hope that in Maine, we will have the framework and resources that don't just provide help in time of crisis, but create a community of care that results in prevention. We often talk about how good food comes from a good place, and the intent and efforts of this proposed work study would ensure that our good Maine food does indeed come from a place of well-being and goodness. And I strongly urge you to vote in favor of LD 2144. I thank you sincerely for your work as citizen legislators, and I welcome any questions you may have for me about our farm, the importance of meeting the needs of mental well-being and health throughout our food system and our heritage industries, or any questions you may have about our favorite cows.
Well done. Powerful testimony. Thank you for being here today. Questions from the committee? I'm seeing none.
Thanks.
Testimony here in the committee room in support. Anybody online? Testimony in opposition? Testimony neither for nor against? Questions from the committee for our analyst? Requests for additional info? Seeing none, I'll close the public hearing. And I will open the public hearing on LD 2117. Presented by Representative Melanie Sachs. Welcome.
Thank you, Madam Chair. Okay to begin?
It is.
Thank you. Hello, Representative Meyer and esteemed members of the Health and Human Services Committee. My name is Melanie Sachs. I'm honored to represent the community of Freeport in the Maine legislature and so grateful to be with you this afternoon. I am pleased to sponsor this resolve directing the Department of Health and Human Services to amend the Maine Care Benefits Manual to provide greater stability and protection for individuals with intellectual disabilities or autism spectrum disorder living in two-person residential homes. This resolve makes thoughtful, targeted changes that recognize both the reality of our current residential services systems under Section 21 and the profound importance of continuity, safety, and stability for vulnerable residents.
This bill does not, and I have emphasized this in several very productive conversations with the good folks at DHHS, seek to fundamentally change the department's structured vacancy process or to resolve broader system-wide challenges. Frankly, that's a first session bill, and I am here with a second session bill for you. Instead, it provides modest flexibility within the existing framework to support members who are stable, safe, and thriving in their chosen homes without facing eviction due to circumstances beyond their control. Reducing the number of destabilizing discharge notice is the goal of this bill, the problem we are trying to solve today. So the first proposed change extends the bed hold period for a hospitalized member from 30 to 60 days. Why? Because for individuals receiving Section 21 services, hospitalization may be for mental health treatment or physical health treatment or both, and many have complex, highly individualized care plans. Under current rules, if there is no, quote, imminent plan of discharge, a provider is required to issue a discharge notice, what is in effect an eviction notice, to a hospitalized member. These abrupt timelines and a looming threat of displacement can be deeply destabilizing, undermining both recovery and quality of life. This resolve ensures that a member who, for example, might have 35 days in the hospital of inpatient care is not issued an eviction notice simply because they're receiving medically necessary treatment. Extending that bed hold period just from 30 to 60 days reflects compassion, common sense, and the understanding that threatening housing stability does not improve health outcomes. So the second part of this resolve addresses the process for filling a vacancy in a two-person residence, regardless of the reason for that vacancy. A roommate may be hospitalized and unable to return, may move closer to family, or their providers may relocate out of state, decisions many of us make when choosing where to live. Under current rules, a provider must issue a discharge or eviction notice to the remaining member after 90 days, regardless of how long that individual has lived in that home, the reason for the vacancy, or the provider's documented and often extensive efforts to fill that vacancy. So this bill just proposes extending that initial period from 90 to 120 days and allows for reasonable extensions where there are documented efforts to find a suitable housemate. These provisions strike an important balance between the operational needs of the providers, the fundamental need for housing stability, ensuring that eviction is truly a last resort rather than an automatic consequence of vacancy. I'd like to highlight the length of the residency exception that is in this bill. Allowing a long-term resident to stay, you'll note in the bill we picked 5 years. So a long-term resident, somebody who's lived there for 5 years. As long as efforts are continuing within the structure of the current rule, reflects a basic truth that these residences are not interchangeable units. This isn't just a bed. This is someone's home. So the flexibility built into this resolve allows the department to continue prioritizing health and safety while preserving long-term, long-standing living arrangements. At its heart, it is a simple bill about protecting one's home and the right to that home and removing that constant threat of discharge or eviction from that home. So why did I bring this forward? Because of, as I think I said to you last time, all the best bills come from constituents. So Natalie and her mother Alice are beloved members of the Freeport community. If you ever see the 4th of July parade, you will see them with their crazy wig hats going along Main Street, waving to everybody as part of Mainly Hair. When Alice contacted me last May, she did not know where else to turn. As you'll hear today, in October 2024, Alice converted the family home into a licensed two-person residential group home with trusted providers so that her daughter, Natalie, could remain in the only home she's ever known. Natalie's provider immediately began searching for a roommate, utilizing the vendor call list, which I can answer questions about, in accordance with existing protocol. In December of 2024, DHHS lifted the COVID era flexibility that had been Appendix K, which resulted in a $5 million in savings in the biennial budget, which came before this committee. From 2020 to 2024, a single resident could remain in that two-person home without threat of discharge, without that eviction notice. By repealing Appendix K, as they did in 2024, the rule reverted to its current language, which requires those discharge notices if the vacancies were not filled. Under that rule, as we've noted, the roommate who is not found in 30 or 90 days, the member must be moved to another location without consideration of their community, family, or individual circumstances. It is simply to fill a bed. As you will hear today, Natalie's provider has worked diligently for more than a year to fill that vacancy and continues to pursue every available avenue, including hiring additional staff for outreach and following up on every lead. You'll also hear from Natalie's mom, Alice, and from Natalie's other providers about what this process has meant for families. For Natalie and Alice, and for many other Mainers who truly consider their residence their home, we offer LD 2117. These modest changes promote stability, dignity, and person-centered care while maintaining a reasonable structure and accountability for both providers and the department. They build on existing protocols while recognizing the fundamental importance of home and community, particularly for long-term members. I respectfully urge the committee to support this resolve and the meaningful protection it provides for some of Maine's most vulnerable and cherished members. And I thank you for your time and thoughtful consideration.
Thank you, Representative Sachs. Questions from the committee? Representative Zager.
Thank you, Madam Chair. I don't know if you know this, but roughly like of all the beds, like how many of them are two-person beds? Is that something you've come across in your work on
I
this?
might have, yes.
Okay.
So, as of Friday, this past Friday, there's 1,984 people who have chosen group home placement within Section 21. As this committee may know, that CMS approves 3,423 folks within Section 21. As of Friday, it was 1,984. Last September, it was 1,962. So as people move, if they choose, as they come into service, they may choose a two-person home or not.
I'm sorry, so what was the
They may
numerator?
choose to go into a group home or not, depending on their level of care and their needs. So that's why the numbers fluctuate. Why in September it was 1,962 and now it's 1,984.
That's
'Cause people
total
do
people
move.
in group homes.
Yes.
And so that's the denominator. Like how many of those are in two-person?
Those are all two-person vacancies and the department can, or two-person residential facilities.
Okay, so just under 2,000 people in
Yes.
two-person. Okay,
Yes.
thank
And
you.
Derek can certainly correct me if I'm wrong.
Okay, thank you.
Could you elaborate on the vendor call list?
Sure. And so daily, that you'll hear from Woodfords, who have been Natalie's case managers for 25 years. They're here in the room. So when a client or a member says, and the family, they decide that group home placement is as the service that they need, among other services, they put that client on a vendor call list, and that gets sent to the provider agencies such as Serenity, which is the provider of choice for Natalie and Alice. And so when Max, who you will hear from later, gets the vendor call list and sees that there are members waiting for group home placement, they look at what they have. And for example, in Natalie's case, in January, there were 7 people looking for a placement, someplace to fill the vacancy. 5 of them are male. So that didn't work. One of them wanted Androscoggin County, we're Cumberland County, and one wanted more Southern Maine. So the process of matching, and you'll find sometimes it takes a while to find a match as well. And so the 30, the 60 days, the 90 days isn't really working sometimes because we've lost the month of January already. So we're just asking for a little more flexibility.
Thank you, Representative.
Thank you very much for your time. And I will note that Senate President Daughtry, who is Natalie and Alice's senator, wanted to be here today, but had an emergency. So you will find her testimony in your written documents at another time.
Thank you.
Thank you.
Any other co-sponsors in the room? Hello, Kid Committee. Welcome. Good afternoon. And if I always have this problem pronouncing people's names, so it's Ingwerson. Is that proper? Okay. Good afternoon, Senator Ingwerson, Representative Meyer, and members of the Health and Human Services Committee. My name is Poppy Arford, and I have the distinct privilege of representing House District 101, the western part of Brunswick. As a co-sponsor of this bill, I stand before you to ask that you vote in favor of this resolve, directing the Department of Health and Human Services to amend the Maine Care Benefits Manual to provide greater stability and continuity of care for people with disabilities living in a two-person residential home. I ask this as LD 2117 presents a common sense solution to a small number of cases within two-person residential settings that deserve thoughtful, person-centered attention. When one resident of a two-person residential home vacates the residence, current policy requires a time-bound discharge process be initiated for the remaining member. This process includes an expectation that the remaining member, if the vacancy is not filled, must vacate the home. For an individual who has resided in a residential home, for a disabled individual who has resided in a residential home, often for years with consistent and reliable supports, that degree of housing insecurity is deeply, profoundly destabilizing and can have significant negative consequences on their well-being and connection to their community. As an active member in a district that includes the Independence Association and their Spindlework community program, I have seen firsthand how valuable and irreplaceable these connections are. In fact, a constituent who is a parent of a 45-year-old with complex medical, intellectual, and mental health disabilities has provided the following insight and given me her permission to share them with you. In her words, I cannot stress enough how important stable housing has been for my son, who lives in a residential home. It has been foundational in providing him a safe space to fully participate in life as he is able. Stable housing has allowed him to develop trusted relationships where his direct support professionals understand his needs. This has resulted in fewer medication errors, has accommodated his dietary needs to maintain his health, has resulted in fewer hospitalizations and crises, and allowed greater independence because of the confidence he feels. Because of stable housing, my son is a valued volunteer at Midcoast Hunger Prevention, Meals on Wheels, our local library, and the hospital. None of these inclusive community building opportunities happen without a strong housing foundation. I and many of my fellow parents of children with disabilities am aging and will not always be here to advocate on their behalf. He deserves to live safely and securely in his home as long as possible, without the threat of a move that will have serious repercussions. LD 2117 allows for a well-thought-out process to ensure the housing security people with disabilities deserve. I agree and understand how critically important it is that these individuals, their families, and the providers that support them have a housing system that is stable, predictable, and capable of prioritizing continuity of care and housing in all circumstances. I will end by again asking for your ought to pass vote. I am happy to take questions, yet understand that the providers and the people impacted by this legislation will be testifying next. Thank you, Representative Arford. Questions from the committee? I'm seeing none. Thanks Thank for you being very here. much for hearing my testimony. Any other co-sponsors in the room? Seeing none, we will start with testimony in support.
Senator Ingerson, Representative Meyer, and esteemed members of the Joint Standing Committee on Health and Human Services. My name is Alice Pelletier. I live in Freeport, Maine. I am testifying in support of LD 2117 on behalf of myself and my daughter, Natalie. Natalie is 32 years old. She has been diagnosed with autism, epilepsy, bipolar, mental retardation, depression, and anxiety. She is nonverbal, but communicates through picture communication devices such as an iPad. She loves swimming, her friends, going out in the community, especially eating out where she can watch the cooks, or going to the movies and books. Natalie has been in our family home her whole life. It is just me and Natalie. I work as a hairdresser in Freeport to support the two of us. Her father died a few years ago, and we have no family in the area. I have struggled to put food on the table as a single small business owner and still provide the 24-hour care that Natalie needs. We have tried home-based care. We were authorized 84 hours a week of care, but due to staffing, they could only usually provide 40 hours, which is not enough, or even if I came in after work. I looked at shared living, where they pay a family member to stay at home, but I couldn't afford to give up my business and pay our bills. Not only would I have to shut down my business, but I would have to then pay caregivers out of a small shared living payment to do things like my own doctor's appointments. She was rejected by day programs because her needs are one-to-one care, and these programs have 3-to-1 staffing. I worry about what will happen to Natalie after I am gone. She and I lived in the upper floor of the home together with my salon on the bottom floor until last year. After talking with other families, I found out that I could turn our family home into a group home. I converted the upstairs to a living space for Natalie and a roommate, and converted the bottom into living space for myself with a small space to still cut hair. I interviewed and selected a provider which I love working with, Serenity. I have been trying to find a roommate. We have been trying to find a roommate since it became a group home in October 2024. Due to COVID in 2020, DHS allowed single placements in a 2-person home, and they had not changed the rule in 4 years. In December 2024, they went back to the old rule. That said, if you did not have a roommate in 30 days to fill that bed, the provider was required to issue a discharge notice, and Natalie would have to go to another group home so that they can fill an empty bed somewhere else. We have filed a grievance to have a hearing and appeal our case. But if we fail and you don't change the law, Natalie will be told to leave her home. This is not just a bed. This is Natalie's home, where she has lived for decades. With a solid care plan in place and community who loves her, I ask that you pass this bill to help Natalie and families like mine who are doing the right thing and trying to comply with the rules. Thank you for your time and your support.
Thank you for being here. You've filed a grievance.
Yes.
And is there a date for the appeal?
No.
Okay. Well, when was the grievance filed?
I'm not sure when that grievance was filed.
In the
Probably,
last month, 6 weeks?
No, it's been a couple months anyway, if not longer than that.
And is there any communication between the filing of a grievance and a date received for an appeal?
No.
Okay. Questions from the committee? Representative.
Thank you very much for being here. And your stories really illuminates how this bill affects people's lives. Thank you for sharing it. Can you share with us what's the challenges, like a little bit more about your efforts to, and like why it's so hard to find a roommate?
Well, just with Natalie's friends, we've communicated with them, and their parents aren't ready to let go. They're not ready to put their child in a group home, for one thing. With Natalie's friends, there certainly are some good matches out there that I know, but their families are not ready. It's a hard thing to do. The agency have been working with all the vendor calls and everything, doing everything they can to find a roommate. And I think like Melanie said, one didn't want to leave Androscoggin County. A lot of them are males. She would be better off with a female, a one bathroom situation. And they've just not found us. One lady was going to come look at the house. She had a cat. We don't have cats in the house.
And the extension to another 30 days would help how?
An extension for a very long time would help in a lot of ways. I mean, 30 days, 90 days, 120 days, it doesn't matter. I mean, we've been looking for over a year now. And we have not been able to find a suitable roommate or roommate at all. We haven't had anyone even look at our home. Is it because it's in Freeport? Maybe, you know, maybe people want to live in more of an urban setting like Portland or whatever. I don't know that answer. I don't know. I know that they've been working diligently. Serenity, even as Melanie said, hired a person to do just that job, to find roommates for these group homes, and nothing, no one's come. So we haven't, it's not that we haven't tried for over a year now to find a roommate.
Thank you.
Representative Lemon.
Thank you for what you do for your daughter. I'm blown away here. I didn't even know this was going on. This doesn't make sense to me at all. I'm really torn. Serenity, you said that the provider is Serenity?
That's correct.
What do they provide?
They provide 24/7 care for my daughter.
Okay, so there's somebody there all the time.
There has to be, yes.
And wow, I'll leave it there for now. I have more questions, but I have to wait to get my composure because this is bothering me so much. Thank you.
Thank you for being here. Testimony in support.
Good afternoon. I have my own testimony, and then I'm supporting Kelly in her testimony. She's a member in our services. So just to clarify why we're both standing here. I also, as a provider, may be able to answer some of the questions you had from a perspective of a provider. I know Serenity is on Zoom as well, but if you do have questions. Good afternoon, Senator Ingwerson, Representative Meyer, and esteemed members of the Health and Human Services Committee. I am in support of LD 2117. My name is Danielle Lamy. I'm the Residential Clinical Director and Case Management Supervisor for Ubuntu Care. I've been a practiced licensed mental health professional working solely in the IDD and autism sector in both Massachusetts and Maine for 16 years. LD 2117 was perfectly described by all of the co-sponsors, so I'm going to speak directly to how, as a provider and case manager, we are impacted through services for our members. I'd like to highlight one situation we have at Ubuntu Care right now. This individual has been served by Ubuntu Care since 2019, highlighting the longevity that the previous person mentioned. The owners of Ubuntu Care have not only supported him in their current agency, they were previously his direct support professionals, house supervisors, and long-term natural supports. He has a documented history of complex, challenging behaviors, significant mental health needs, and as he ages, medical needs as well. In his current placement, he has required involvement from DHH Crisis Supports and Disability Rights Maine. So he's supported through different sectors of the state, not just provider and case management agencies. Through his current agency support, he's made meaningful progress. This progress has been made through him living by himself without a roommate, self-identified by him as a trigger to his trauma experiences. his current interdisciplinary team has determined introducing a housemate would jeopardize that progress and place both him and the potential roommate at risk of harm. Consistent with HCBS principles of self-determination and informed choice, this member himself has repeatedly and clearly expressed that he does not want a roommate. Additionally, not all provider agencies out there are available to serve this individual. He requires nursing oversight due to diabetes management, as well as clinical support through a positive support plan and crisis plan with DS Crisis. Following the return of the vacancy protocol enforcement, the member's case manager applied for ADA accommodation. This began in December of 2024 now. We are still in process. The request was initially denied. The member's case manager and supporting team helped them in the grievance appeal process and continued throughout the steps of the process and was also denied. This is a reminder that his interdisciplinary team, everyone who has known him since 2019, supports that he remain alone in his home. To ensure the member's safety, stability, and continuity of care, Ubuntu Care has continued providing services without authorization from the state and without reimbursement. We are currently unpaid for providing services to this individual. LD 2117 would help prevent situations like this by allowing teams flexibility needed and additional time. I urge the committee to support this resolve.
Thank you.
So that's my piece of it.
That's your piece of it? Yes. You're going to stay up there for support.
This side. Right. This side, right. Hi, my name is Kelly Turner, and I am a member who resides at Ubuntu Care, Section 21, provider of home support. I also utilize case management services, assisted technology services, and vocational rehabilitational services. I have been in and out of services for most of my life. Moving has been extremely stressful experience for me, especially knowing that if a roommate were to leave, I could be at risk of eviction. Living with that constant uncertainty does not feel fair or safe. Currently, housing requirements have put many people, including myself, into living situations which incompatible roommates in my case. This has
Do you want to just say how it's affected you instead of reading?
Sure.
Yeah, sometimes, sorry.
It's affected me with trauma. I have severe PTSD and post-traumatic stress, and I have health issues too. So having to have roommates that are violent are not okay. And I feel like you're putting people that aren't compatible, which I had a roommate that actually physically attacked me twice, and I have health issues from that. I feel that passing this bill will give more time for people to find compatible roommates. My roommate, we had a little issues, but now we get along, and she agrees that if I were to move, she'd be at the same. And I would like you to pass this bill to give more time, because each person has a different care level and learning disabilities.
Thank you.
Thank
Thank
you.
you, Ms. Turner. Appreciate your being here today. Questions from the committee? I'm seeing none.
Thank you.
Testimony and support in the room.
Hi there.
Welcome.
Good afternoon, Senator Ingerson, Representative Meyer, and distinguished members of the Health and Human Services Committee. Thank you for the opportunity to provide testimony in support of LD 2117. My name is Rebecca LaChance, and I'm the Director of Adult Case Management at Woodford's Family Services in Westbrook. Our team has been providing case management services to Natalie and her family when she turned 18. She's 32 years old now. Throughout her life, Natalie has received unwavering support from her loving family. Her mother, Alice, is her legal guardian and makes all decisions on Natalie's behalf, as Natalie's nonverbal and unable to communicate her choices. Natalie requires 24/7 total care to complete all activities of daily living, including personal hygiene, toileting, and she cannot be left alone at all due to her significant health and safety concerns. Natalie resides in Freeport and receives 24/7 agency home support through Serenity Residential Care. This arrangement has allowed her to remain in her community, maintain lifelong routines, and continue receiving daily support from her family. This is all Natalie has ever known. She's never had a roommate, having lived exclusively with her parents. Given Natalie's high level of need, introducing a roommate presents significant challenges for her. Natalie experiences periods of dysregulation that may look like pacing, pushing, repeatedly getting up and down from the ground, screaming, and occasionally disrobing. During these episodes, she has little awareness of others around her. The impact on a housemate could be profound and could pose serious safety and emotional concerns for all involved. A request for an ADA modification to allow Natalie to live alone was denied. Following that denial, the team pursued identifying a roommate through the vendor call process. However, more than a year later, no appropriate match has been identified. The current 30-day timeframe is not sufficient. In practice, this equates to only 20 to 22 working days. It's not a realistic window to identify, meet, and thoroughly vet a potential roommate and complete a safe and thoughtful move-in process. Even if a potential match is identified, the person-centered planning and approval process can take several additional weeks. More time is needed to ensure that consumers and their guardians are afforded meaningful choices regarding who they live with and where they live, while maintaining health, safety, and dignity. Thank you for your time and thoughtful consideration. I respectfully urge you to support LD 2117.
Thank you for being here. Questions? Senator?
Thanks for your testimony. I have a question about the ADA modification.
Yep.
Could you speak to that a little bit? It seems like maybe one of the few workarounds to the DHHS rule that would allow for an exception.
That was denied. I
Yes.
can, yeah, I will go back to my team and get the specific details around the time frame of that too,
the
because
work
I do think it's important and
Yeah, I'd
understanding
like to
that.
learn a little bit more about.
Yeah,
that.
yep.
Thank you.
Representative Graham and then Zager? No, Representative Graham.
Thank you, Madam Chair. Thank you for being here. A couple questions. One is it even feasible for an individual like Natalie to have a roommate at all?
That's a great question. And I think Alice, as Natalie's guardian, knows her daughter best. And makes decisions for Natalie. And I think finding the right roommate for Natalie takes a lot of time. You can't just put anybody in there.
My second question is, we've been doing this, I have a sense, for a while. And I think that, do you feel like there are other Natalies out there, as we see our individuals with autism spectrum disorder aging? I have a sense there are a lot of other Natalies out there.
100%. And Natalie is on Natalie's journey, and that's different, and that's unique to Natalie. And not every consumer resident in the Maine is going to fall into that. This process isn't going to work for everybody.
Yeah, so I think my point is, this is something that needs to be looked at because we have an aging population of individuals on the autism spectrum and with other disabilities that we need to address this moving forward.
Yes.
Thank you.
Representative.
Thank you. I had two questions and the senator stole one of them. The second one is, are you able to give us the reason why she was denied?
I would like to loop back with Alice and with Melanie on that, but I can get you that information.
I really would like that.
Yep.
Thank you.
I'll definitely get that to you.
Seeing no other questions, thanks for being
Thank you.
here.
So I'm too short to see the clock. So, yeah. All right. Good afternoon, Senator Ingverson, Representative Meyer, and esteemed members of the Health and Human Services Committee. I am testifying today in support of LD 2117. My name is Kristen Overton, and I'm the Executive Director of Skills, Inc. Skills is a nonprofit organization in rural Maine, serving people with intellectual and developmental disabilities for more than 60 years. Skills provides more than 120 people with support under 21, 29, and 97. Our core principle is that people with disabilities want the same things we all want: a safe place to live, people who care about them, and to live, work, and belong in their community of choice. As part of our residential services, we have 8 waiver-funded group homes. Last year at this time, we had 9. More than 60% of the people who live in one of our homes are aging adults who wish to age in place. They are more frail and more at risk of serious complications in the event of an illness, accident, or injury. We closed a 3-person home in rural Clinton in May of 2025 because we struggled to keep it filled above 2 people, which was 66% occupancy. We knew that it was very likely that we would be forced to close it in the event that someone was hospitalized or chose to move. We made the decision to preemptively close the home and allow our residents time to find the right place for them rather than being suddenly forced out with a notice due to no cause of their own making. Section 21 Maine Care does not pay for housing-related costs, including food, utilities, furniture, and household supplies. These are paid for the people that live there. Maine Care covers the staffing. LD 2117 takes significant steps towards maintaining stability for the people who live in a group home. One of the principles of the HCBS settings rules is that people choose where they live and who they live with. In a rural setting, there are less housing options within small, close-knit communities. Having a say in who their housemates are and being guaranteed a home and community to come back to if they have a hospitalization and rehab stay is crucial to belonging. Last year, we had an older gentleman who lives in one of our homes. He's a larger man and uses a walker, and his mobility was slowly decreasing. After an accident, he was hospitalized and needed to go into rehab to rebuild his strength. It was estimated he would need to be in rehab for another 6 to 8 weeks after nearly a week in the hospital. One of his housemates had moved closer to his brother within the past 30 days, leaving a vacancy in the 3-bedroom home, making it a 2-bedroom. For purposes of this rule. This meant that we had to provide him and his remaining housemates a 30-day notice while he was in rehab. He returned after 9 weeks away, which would have left both he and his housemate evicted. However, we were luckily able to fill that open vacancy in the last weeks of the notice period. It was a close call. That's why we closed the Clinton home. Fearing being homeless due to a hospitalization is not fair to anyone. This bill would resolve this common issue. I urge you to support LD 2117 and welcome any questions that you have.
Thank you, Kristen. Questions from the committee? Seeing none. Thank you for being here. Testimony and support.
Good afternoon, Senator Ingverson, Representative Meyer, honored members of the committee. I was not expecting to speak today, but Brett Bulmer, who is the Executive Director of Independence Association, which is a Brunswick-based services organization, asked me to read his testimony. Actually, Poppy insisted I read his testimony. But he gave me permission. Exactly. Anyway, so I'm writing in strong support of LD 2117 because it addresses a very practical problem in our system. The pressure to fill residential vacancies quickly, often before it is clear whether a potential placement is truly a good fit. Who you live with matters. If you were selecting a roommate, you would expect the time and freedom to make a thoughtful decision because it directly affects your quality of life. People with disabilities deserve the same respect and consideration. Under current rules for two-person homes, providers are sometimes forced to fill vacant beds with relatively short timeframes to remain in compliance. While agencies work hard to make thoughtful placements, these timelines can lead to decisions before compatibility is fully understood. This increases the risk of placing someone in a home that does not meet their needs or pairing individuals who are not well matched. Residential placements succeed or fail largely based on compatibility. When matches are thoughtful and person-centered, homes tend to be more stable, routines are maintained, and individuals experience greater safety and quality of life. When placements are rushed, the result is often increased behavioral challenges, emotional distress, staff burnout, and in some cases, placement breakdowns that are disruptive and traumatic for everyone involved. LD 2117 provides modest but important flexibility in two-person homes by extending the amount of time providers have to identify a suitable housemate before eviction notices are triggered for remaining residents. This is particularly important for individuals who have lived in their homes for many years and who may face significant distress or regression. If forced to relocate solely because a compatible roommate cannot be found quickly enough. The bill also includes provisions extending the length of time before eviction when active matching efforts are underway, as well as allowing additional time for bed holds during hospitalizations. Together, these changes reduce the risk of unnecessary displacement following medical events and support continuity of care. These adjustments promote more person-centered decision-making. They allow time to properly assess compatibility, involve individuals in decisions about their living environment, prepare staff and homes appropriately, and reduce the likelihood of finding placements and emergency relocations. Thank you.
Thank you. Questions from the committee? Seeing none.
Okay, we're just going to fill out the.
Okay. Welcome.
Thank you. I'm taller, so I'll put it up. Good afternoon, Senator Ingerson, Representative Meyer, and esteemed members of the Health and Human Services Committee. Thank you for the opportunity to testify in support of LD 2117. My name is Amanda Caromba, CEO of Happy Haven, as well as Chair of the Residential Services Committee for the Maine Association for Community Service Providers, also known as MACSP. MACSP represents nearly 100 agencies across Maine that support individuals with IDD and brain injuries to live meaningful lives in their community. My sincere gratitude to Representative Sachs for bringing this bill forward and for recognizing the profound impact that housing instability and eviction have on people with IDD and their families. LD 2117 addresses a narrow but very real problem within the two-person home vacancy rule. The department designed this system, approves providers, and operates the vendor call process. Since enforcement resumed last year, providers and case managers have worked in good faith to comply, actively using vendor calls, coordinating with families, and seeking appropriate matches. But in rare situations, despite documented and ongoing efforts, placements simply take longer. When the vacancy protocol is exhausted, providers may be forced to issue eviction notices, even when no safe or appropriate alternative exists. In those moments, providers often continue supports anyway, as you heard, to protect the individual's health and safety, absorbing financial and operational risk to prevent harm. LD 2117 offers a reasonable solution. It allows for a short additional window, 30 days before an eviction notice is required, with the option for up to 2 time-limited extensions that must be requested and fully documented. These extensions are not automatic. They require clear evidence on ongoing placement efforts and maintain accountability across the system. This bill does not weaken the two-person rule. Instead, it prevents rushed evictions and unstable placements that can lead to repeated moves, which I've seen, failed matches, crisis situations, and higher long-term costs. Most importantly, it preserves the dignity, choice, and stability for people who call these homes their home. So just to answer a couple of the questions that were mentioned, the vendor call system, unfortunately, is very, there are a lot of gaps and inconsistencies. There's, people that have been on there for years. But again, it's moving someone from one side of the state to the other side. No one wants that, right? These are their homes. Also, the ADA modification, we've seen denials come through, and the reason being either that there are a lot of open beds in the state that they can move to. That's been a hard response to hear and to provide to families and individuals who consider these places their homes. And also other questions, we can provide answers before the work session.
Thank you. Questions? Seeing none, appreciate you being here.
Thank you.
Further testimony in the room in support? Anybody online?
Hello, can you hear me?
We can. Welcome. We're
All
running
right.
a 3-minute clock. I'll give you a gentle nudge as we're getting close to 3.
Sounds good. I should be able to stick to that. So,
Great.
good morning or good afternoon, Senator Ingwerson and Representative Meyer and honorable members of the Mental Health and Human Services Committee. My name is Maxwell Haney, and I'm the Senior Program Manager for Serenity Residential Care. We're Natalie's provider. We're a group home provider for individuals with intellectual disabilities and autism spectrum disorder. I've been here for over 4 years of experience in this role, and I'm eager to share my thoughts on this proposed change to the main care rule. So I was fortunate to work closely with Melanie Sachs on the proposed bill from the very beginning, which stemmed from the discontinuation of the Appendix K rule. As a result, we followed orders and provided the discharge letters to individuals who fell under this policy, a process that I must admit was distressing for all parties involved. One example that stands out is our work with an individual who resides in her childhood home, as we've heard today, which we have converted into a group home after being selected as the provider by her family. This individual was previously been dissatisfied with her support services, but with our team's help, they began to thrive. However, when we started searching for a female roommate, we encountered significant challenges in finding a compatible match. As a provider, I am deeply invested in filling our homes with individuals who require our care and support. Simply stated, it's good business to fill our vacancies. However, I want to highlight the challenges of this process. The vendor call list, which is the primary resource for outreach and potential new members, has proven to be inadequate. In 2025, last year, there were about 76 individuals posted on the vendor call list that matched this service location. And while outreaching to every case manager on the list, it resulted in not a single tour of this location. This current month alone, January 2026, we have encountered 7 potential individuals seeking new placements, but only 5 of them matched the service location for our available home in Freeport. Moreover, for the specific individual we are discussing today, only 1 of the 7 is female, and she has expressed a desire not to live in the town where we have an available opening. Consequently, we are left with no viable options, and the clock of mandatory discharge and disruptive relocation continues to tick. I strongly believe that we must move beyond the notion of simply filling beds. These are not just empty beds, they are homes where people can live, grow, and thrive. The term filling bed diminishes the humanity of the individuals we serve. Our organization has adopted the Home and Community-Based Service, or HCBS policies, which I firmly believe are a step in the right direction. For the first time in history, individuals with disabilities have the right to choose what they want for themselves, and we have seen a positive impact on those lives. The current policy of issuing discharge letters when we are unable to fill a bed with a certain time frame is at odds with the principles of HCBS. It is hypocritical to tell our individuals that they have choice and autonomy only to take it away from them when it becomes inconvenient. Happiness and stability should not be sacrificed for the sake of bureaucratic efficiency. Instead, we should prioritize the routine, familiarity, and quality support that our individuals rely on for their well-being. I think these changes to this policy presented today are a great step in the right direction. I thank Melanie Sachs, who took the time to hear our concerns and get us to this point today. I appreciate your time in hearing some of our firsthand experiences and considering this small change. And I'm happy to take questions and talk about some of the questions that maybe weren't answered in specific to Natalie's case.
Thank you. Thank you for being here today. Questions from the committee? I'm seeing none. Anybody else, Sophie? Testimony in opposition. Welcome.
Welcome. Thank you. Good afternoon. Thank you, Senator Ingerson and Representative Meyer. And thank you to the members of the Joint Standing Committee for Health and Human Services. My name is Derek Fales. I'm the Associate Director for Developmental Disabilities and Brain Injury with the Office of Aging and Disability Services within the Department of Health and Human Services. First, I want to take a moment to thank everybody who spoke today. Often these are the stories that I hear day in and day out as we approach supporting individuals to live the life that they want in the community that they want. And I take that very seriously, having worked for children and families for over 20 years. This resolve, LD 2117, directs the Department of Health and Human Services to amend its rule, Chapter 101, Main Care Benefits Manual, Chapter 2, Section 21, our home and community benefits for members with intellectual disabilities or autism spectrum disorder. And I am here to provide opposition to this bill.
Turn that off.
I will tell you why. The opposition to this bill is rooted in the fact, and based upon the stories that I've heard, this bill will not address the underlying causes of where our service system is today. Directly answering some of the questions that I've heard during the testimony, during the Appendix K, happens during the public health emergency, CMS approved the state's request to modify its rules to ensure that people were safe during the pandemic, to ensure that they would not have to move out of the home and stay safe as we are all facing COVID-19. The department did not repeal the Appendix K. Simply put, federal government does not allow states to continue their flexibilities when the public health emergency ended. So we had 6 months after the federal end of the public health emergency to resume our rules and regulations. One of those is the 2-person minimum for our group homes. This resolve does do several things. First, it does extend the bed hold payment period during hospitalization from 30 to 60 days. It extends the time frame for a provider to locate a new housemate from 90 to 120 days, and it creates an additional extension process that could add 2 additional 60-day extensions and potentially further extensions for individuals who have lived at the address for more than 5 years. While the department's fiscal analysis does indicate that over time that this would increase waiver costs for the Section 21 program, what it does not do, it does not address the underlying drivers of housing availability and matching. I can tell you currently when I'm looking at all of our area agencies in our group homes across the state. What I can tell you is that providers continue to bring on group homes day in and day out. So we are having 2,000 people who are served within Section 21 that are residing in agency group homes, and the number of group homes continues to rise as providers bring on new homes. Because Section 21 has a wait list, attrition, and meaning that we can give a new funded spot when somebody leaves Section 21. So what that means is roughly between 90 and 100 people on a yearly basis, they're leaving Section 21, and that offers the chance for 90 to 100 people to give a funded offer so that they can choose services. And if a person chooses to live in an agency group home, they have free choice of all the available group homes. So now you can see the problem is more and more group homes are coming onto the system. As people may choose to leave a home, they may find a provider that they choose that has a better home, maybe they've done some renovations or whatever happens, the person gets to choose. That is the foundation of our home and community-based services settings rule. And so now you have individuals who may have been residing in a group home who choose to leave to go to another home that's just come on. Or you may have somebody that has left and now that person is there in a home and they need to find a roommate. This LD will not solve the issue that we're trying to solve. The issue that we're trying to solve is how do we support people to live the life that they want in their home. The department does support the goal of stability and reducing disruptive moods. Oftentimes, the department does extend authorizations to ensure that the member is safe. Oftentimes, the department does request from the providers to submit how they've been looking for new roommates. Oftentimes, we want to know what the staffing is. Oftentimes, we want to know how the provider is staffing that as we continue to face a workforce shortage. So every single person placement means that there has to be at least one direct support professional in that home 24/7. As the state continues to face additional workforce shortages, this LD may prolong those concerns of how do we ensure that there's sufficient staff in the workforce to support people living in the homes that they're choosing. Extending timelines does not address the underlying system challenge, effective housemate matching, or timely placement into existing vacancies. Our analysis does show that there are 98 waiver members who are currently in single-person placements without approval from the Americans with Disabilities Act, which provides for a modification to the department's rule. So for certain circumstances, such as risk of institutionalism or other disability-related reasons. A statewide extension of timelines would increase costs without resolving the structural drivers of continued homes coming online, which will further increase the existing persistent vacancies and lead to further housing instability as more and more homes come on. Therefore, the department recommends us focusing on system-level strategies that directly address persistent vacancies, including strengthening placement coordination to prioritize filling existing vacancies, better aligning provider incentives with full occupancy, and using targeted ADA modifications or individualized exceptions when a member's disability-related needs support single occupancy. Thank you for your time and attention. I'd be happy to answer any questions you may have, and I will make myself available for the work session.
Representative McCabe, Shiguri, and Lemelin, in that order.
Thank you, Madam Chair. Thank you for your time this afternoon. How many ADA modification requests have you denied since the Appendix K reverted back to the original federal standards?
Thank you, Representative. That's a great question. Our ADA process is managed through our Commissioner's Office. I don't have the exact number of denials, but that's something that we can certainly provide.
Thank you, Madam Chair. Thank you for coming today. You said you have 98 waiver members in single residences already due to various reasons. So you have some flexibility in the rule to allow for exceptions, right?
Great question, Representative. So the rule as written, there are discrete timelines that the department has to support providers to meet. There are some exceptions that we can extend authorizations. For instance, if a family files a grievance, that is one of the ways that the department has the authority to extend the authorization through the grievance process, which does provide providers additional time to support finding a housemate.
So there's no exception for creating an unsafe circumstance?
If there was an unsafe circumstance, certainly that we would expect the provider to let us know, and we would certainly manage that on a person-to-person. At no time through this process would we ever expect that a provider would cease delivering services, and we would work with a provider on the next steps.
Okay, thank you.
If we were to pass this bill, does that require CMS approval in some way?
Great question. Thank you, Representative. Currently, our waiver authority, the waiver application describes our agency homes as places where at least 2 people reside. And this, our process for the vacancy just resides in our main care benefits manual. So if, I don't think we'd have to amend our waiver application.
How about if we voted, instead of approving this, we made the law that says we're going to return to Appendix K. Now would you need CMS approval, I mean?
Yes, this great question. The states do not have the authority to bring back any Appendix K flexibilities. That authority rests solely with the federal government.
Right. So if we all right, so we can't do the Appendix K, but could we amend the law to say there is no timeline as long as they're searching for a roommate, and until they find one, that's the way it goes. So an unlimited time period. Would that need CMS approval?
Great question, Representative. I can tell you in that circumstances, for instance, if it was an unlimited time of a single person placement, largely what that means is the way that we pay group homes currently is by staffing. So the agency submits what they believe is an appropriate staffing pattern per home. It's a very comprehensive formula. So it is where we take the amount of staff per person, and then we look at all the people in the home, how much is shared staffing, and then we have to divide, and that's how you come to a daily rate. Single person placements, simply put, just cost more. So the state is obligated by CMS to ensure that we are supporting the number of people that we've said that we need to support on a yearly basis, regardless of what that costs. So as waiver costs continue to increase year after year, the state's authority, for instance, if the department does not have sufficient funds to continue to payment, CMS does not allow the state to reduce the number of people it serves. The state is obligated to continue to pay those providers and agencies. So that is what the single person placement process, the way we pay currently, it's not a true per diem. It is by DSP.
So you're saying that it's only a money issue. So we could pass that bill. CMS would have nothing to do with it. We just have to make sure that there's funding to take care of this young lady and everyone like her. Is that correct? It's just a money issue.
It also is a workforce issue as well. So I can tell you, Representative.
But the workforce is already there. There's already a person taking care of that home. So regardless of whether there's 1 or 2 people in there, correct me if I'm wrong, there's still somebody already there. So we already have the workforce. The only problem is the funding, that this person is now taking care of only one person instead of two. Is that correct?
I can tell you the workforce is not there. So providers, when they are unable to staff the homes, the provider has to reduce what they're claiming for reimbursement. So individuals who are residing in homes or in their own home, they complete reportable events. And we know from our staffing patterns and just from experience that providers are having difficulty to maintaining minimum thresholds, and they have to reduce what they're claiming. So for instance, if a home has 100 hours of DSP hours, we are seeing across the board that providers in many instances are not able to fill all 100 hours. So we are seeing that not all of the hours that the department has approved through the person-centered plan are being filled across the state.
I understand what you're saying, but it's not completely making sense to me, because regardless, like I said, there's already somebody at this home and that person is going to remain there. The only bummer is they're taking care of one person instead of two. So that part's taken care of. So you've answered it. Thank you.
Thank you.
Can we go back to the grievance process?
Yes, thank you, Representative.
So a grievance is filed, and from there, what are the timeframes where the individual who's filed a grievance or someone who's filed it on someone else's behalf can expect before there is communication from the department and some idea of when they'll be heard?
Great question. So the grievance that's filed within 10 days of a service disruption is a stay on the service, and the stay remains in place until there's a hearing with the administrative hearings unit and a decision is made. So the length of time is dependent on when the hearings unit can schedule for a hearing, and many times during this time, we do find that people are able to find a housemate and remain in their home or move to a different location if they choose as well. But there's the time frame as far as scheduling the hearing, that's up to the administrative hearings, but we continue to keep that authorization moving throughout that grievance process.
So the hearings process would be considering the possibility of an individual exception?
During the hearings process, the department gives its reasons for ending the provider's authorization if the single person placement vacancy protocol is not followed, and we suspend or end payment to the provider. In the case of the grievance, we don't end payment to the provider. And so during that hearing, we explain our reasoning and how we followed the main care benefits manual.
Representative Zager, then Senator Ingerson.
Thank you, Madam Chair. Thank you for being here. How does our approach in Maine compare to other states?
Thank you, Representative. That's a great question. I can tell you Maine's approach is somewhat different from other states. And for instance, in Massachusetts, Massachusetts does not have the same 90-day vacancy protocol. It is the payment structure is different. And so the payment structure really supports who's in the home. The provider gets paid a per diem rate that's not dependent on specific DSPs. And often we're seeing those homes around 4 to 6 beds, where in Maine, it is the structure of their per diem, how we develop payment with a provider that's based on DSP hours. That's very unique across the country.
Senator?
Yeah, thanks for being here. I have a question. It seems like in these particular group homes we're talking about where there's 2 or 3 beds, you said is it currently, someone else mentioned, is it currently 1,900 odd clients are there?
So there are correct close to 2,000
Okay.
individuals who are choosing to reside in agency group home.
In the group homes, 2 or 3 beds.
Our agency group homes can be from 2 to 6 beds within
Okay.
Section
All right.
21.
And the people where there's single clients is 98?
Correct.
currently? Does it currently stay around that, or is it starting to increase because you dropped the Part K or?
Great question, Senator. I can tell you, as of the last data that we receive, we are up to 100 individuals who are
Okay.
in approved single-person placements.
Okay. So out of those 100 out of 2,000, how many of them are in grievance? Do you know?
The 100 individuals who are in a single-person placement, it's an approved single-person placement for them. There are 98, and there are a little bit more as of today who are in unapproved single-person placement. I do not have the numbers of those, how many have filed grievances.
Okay. So can you get that to us? And
Yes.
And I just want to clarify something you said to Chair Meyer. During that grievance period, if someone files a grievance, are they still allowed to operate with the one person during that period? They have that grace period?
Yes, Senator.
And do you have anywhere within that decision-making that you have, who's ever making that decision, do you allow exceptions? Do you come to the point where you're like, this is fine, single person works in this case?
Great question. The department's authority of exceptions would not allow for approval to modify the main care rule. So that's through the ADA process. That's why individuals have to apply through the ADA for that exception to modify that main care rule.
So the only way that the grievance would work in the favor of the client would be if they could modify the ADA rule. Is that what you're saying?
Great question, Senator.
I was trying to understand the purpose of a grievance if it isn't granted in favor of, I picture this more like a board that would listen to this unique case.
Great question, Senator. The purpose of the grievance, it does have that protection for the member that the provider cannot evict them. So there is a stay of service.
Right.
That's the essential reason for individuals to seek a grievance, allows time also for that ADA process.
Okay, I got you now. Yeah. Okay, thank you.
Thank you.
So the 100 or so folks who are in approved single-person placements, there's about 100 or so?
Yes.
98.
Representative.
Okay. They are in approved single-person placements because of the ADA modification?
Correct.
Okay. Yes.
Do you know if the ADA modification has some kind of criteria beyond, is there health and safety criteria that they consider?
Great question, Senator. I am not, I would be remiss if I tried to explain the full Americans with Disability Act and the criteria, but I can definitely provide those details later.
I'm just, during the hearing, we heard testimony about caregivers who've known these folks for a long, long time, feel like a single placement is important for health and safety reasons, for emotional security for the person. So I just wondered if there was any kind of criteria that takes that into consideration.
I can definitely get back on the
Can you
details.
get back to the work
Yes,
session?
thank you.
Thank you.
Where is a determination of an ADA modification taking place? Whose role is that to determine and provide?
The department has a ADA coordinator that sits within the Commissioner of the Department of Health and Human Services that reviews information based upon an application and makes that decision from often talking to families, case managers, and to the department.
Okay. And do we know what the process is for reaching that individual? Is there a application process? Is there a call that's made? Do the providers assist the clients and the client's family to pursuing that route?
Great question, Representative. As I do often, will talk to a case manager about our ADA process. I make sure the case manager has the application process, knows what that is, providing sort of written details. We talk about other options that the family may consider depending on what the circumstances are. And I can tell you from the volume of ADA applications, I could assume that my colleagues here in the provider community are aware of the ADA process and are supporting case managers and families. There's a authorization form that you can complete if you're completing it on behalf of somebody else and submitting that to the ADA coordinator.
Understood. So the bill is extending the bed hold, and then it's extending the extensions that are built into the bill might enable case managers and families to both seek a roommate from the vendor call list and also to initiate some of these other processes that are in place in order to, say, become an approved single person placement.
If I may, Representative, just talking, just point of clarification for the bed hold. If an individual is placed in an institution, the department, the provider they cannot discharge the person. So that's actually a protection for the person to make sure that providers are not discharging individuals. What we've seen in the past, because if you're in a hospital, likely the provider is not getting paid. So we do not pay when somebody is in an institution because the hospital is receiving payment. So in instances in the past, providers have discharged individuals when they've gone to the hospital. And so those are, it's a protection to ensure that the provider does not discharge the person if
because
they're not in their home.
You're not paying room and board, you are paying for services.
Yeah,
You're paying
correct,
for the
Representative.
care.
We're paying for the
So-
direct support professionals' time.
Okay. And so what you're saying is when an individual becomes institutionalized, is hospitalized for one reason or another for an extended period of time, it is the provider that's discontinuing services?
So the department suspends, so in technical terms, we suspend the waiver. So we don't terminate the person from the waiver unless it's over 60 days. That is built into our waiver, our application, where we do describe if an individual is not receiving services more than 30 days, what the department will do. That is within the waiver application and approved by CMS. So that is why we often have the dialogue from providers to understand where is a person in a rehab hospital? What does a discharge look like? Are they working towards discharging? Is this, any other needs? We're often continuing that person's placement on the waiver because we're not paying any waiver dollars when the person is hospitalized. So we're simply during this protocol ensuring the provider does not discharge that person.
Any other questions? Representative Shigori.
So a person applies for sole residence through the ADA process, and is it one individual that makes that decision as to whether or not they are granted the sole residence status?
Great question, Representative. It is I would say it's a collaborative approach, or I think is a collaborative approach. So there is the ADA coordinator that does ultimately have to make a decision, and oftentimes we're talking with providers, we're talking with case managers about the situation and whether it meets the criteria of the ADA to grant or not.
And is there an appeal to that?
Great question. Yes, there is always an appeal for the department's decision.
And who would that be, to the courts, or who would that be an appeal to?
Great question. That's appealed to our administrative hearings unit within the department.
Is there an opportunity for an appeal outside of the department?
Great question. I am not, I can take that back. I believe I know the answer, but I don't want to speak for our legal team.
Okay, thank you.
Looks like we finally exhausted questions. Thank you very much.
Thank you.
for-
Thank
yeah,
you.
yeah, for being here today. Any other testimony in opposition? Anybody on Zoom? Testimony neither for nor against, but with additional information for the committee to consider. Seeing none. Questions, requests for additional information for the work session for our analyst. Seeing none, I'll close the public hearing and thank you all for being here today. Do we want to take just a 5-minute break? Yeah, 5 minutes? Thank you all for being patient with us today.
I am so glad our work sessions do not last that long. Holy cow. Oh my gosh.
All right, while the coffee's brewing, we will get to LD 2134, an act to create an exception to the prohibition of tobacco sales in retail establishments containing pharmacies for certain small grocery stores, presented by the bill's sponsor, Senator Chip Curry. Come high up.
Senator Ingerson, distinguished members of the Committee on Health and Human Services. My name is Chip Curry, and I have the honor of representing the 26 rural, coastal, and island communities of Waldo County. Thank you for this opportunity to present LD 2134, an act to create, you've heard the title, it's a long title, I'm not going to say it again. This is a narrow, practical fix to the law, fix to a law that had unintended consequences for some community grocery stores. Last session, the legislature made changes to the tobacco sales laws. I think this committee is familiar with that legislation that were primarily aimed at large chain retailers with in-store pharmacies. But in the process, a handful of smaller locally owned grocery stores were swept up in as well. Stores that happen to lease space to an independently operated pharmacy, but otherwise operate just like any other neighborhood grocery. For these stores, tobacco sales are a lawful product line that help keep their doors open in a very tough retail environment. Losing that revenue because of a technicality in how their building is structured puts additional strain on businesses that are already operating on thin margins and serving communities that may have few other grocery options. LD 2134 creates a clear, limited exception for small grocery stores under 26,000 square feet, where the pharmacy is independently licensed, separately leased, operating as its own business, and this is where it's a grandfather, and was already established in the store prior to July 7, 2025, which is when the governor signed the last legislation. The grocery store must still comply with all other laws governing tobacco sales. This bill does not expand tobacco access, but does prevent the closure and disruption of a small number of pharmacies located in our more rural parts of the state. It corrects an unintended impact on small main grocers and helps to keep pharmacies viable in communities that rely on them. Thank you for your time, and I'd be happy to answer any questions that you have.
Any questions for Senator Curry?
Yeah, I've got one. Thanks for being here. We have any idea how many of these?
I believe someone behind me will have a good number. I believe it's 8. It might be 9, but I think we're talking about that. When the bill came before us, and I was hearing from the original bill sponsor, I was hearing that this wasn't impacting anyone other than the larger ones. And then I think it's true. Those that said they're independent pharmacies were like, yeah, we don't sell tobacco because they're independent pharmacies. They weren't selling tobacco, but they were leasing space from larger grocery stores, grocery stores, mid-level and smaller level grocery stores. And so the goal here is to grandfather them. If there is wide support, I would also ask the committee to consider putting on an emergency clause so that we can go after, if we believe we can get 2/3, so that we can get this into effect. So pharmacies aren't denied leases, so that, from the store owners fearing a trade-off between their tobacco sales and their leases.
Any further questions? Thank you for coming for us with this bill.
Thank you.
Appreciate it. Any testimony in support?
Good afternoon, Senator Ingwerson and Representative Meyer and members of the Committee on the Health and Human Services. My name is Christine Cummings. I'm the Executive Director of the Maine Grocers and Food Producers Association. We represent Maine's grocery community, including some of the national chains to some of the smaller markets and all of those storefronts in between, as well as many of Maine's food producers, beverage processors, and other supporting partners. We're very appreciative of Senator Curry's introduction of this piece of legislation. To answer the question that was addressed earlier, we know of 8 impacted business pairings. As noted in my testimony, those include stores and pharmacies in Oakland, Randolph, Cornish, Corinth, Herman, Fort Kent, Presque Isle, and Unity. And so as we look at these particular business pairings in those communities, we really are talking about independent storefronts, independent pharmacies, and that really rely on each other both for the infrastructure of the business and then also the customer base. And so I won't read from my testimony specifically here, but we are looking for this resolution for these businesses and the unintended consequences of then what is, forcing our retail members to try to determine whether or not the pharmacy or these sales, which come along with other sales, are more important. And ultimately, we are looking for you all to find a resolution so they don't have to make that decision. So happy to answer any questions. And I do have a grocer online who can answer some more specifics if and when that's of interest.
Yes, Representative Zager.
Thank you, Mr. Chair. Thank you for being here. You have the 8 storefronts identified. For the work session, could you provide the nearest pharmacy to those sites so that if a patient needed their prescription filled, what alternatives do they have? These are I think they were all very rural communities, and so I'm interested in that fact.
Yeah, happy to lay that out. Thank you for asking.
I'm curious, and I don't know if this can be done, but I would love a picture. What do these stores look like?
Sure.
25,000 square feet seems big, but it probably is not. And
certainly, I would say the traditional independent storefront, so not as large as some of the chain grocery stores that you would think of that are more prominent. You're talking about more of a rural, mid-size, probably like could be a independently sourced Hannaford or an IGA or a market of some sort is probably a way to frame that.
So it could be an IGA or Hannaford that sells Hannaford, right? Because I imagine the one in Cornish is probably that little IGA, but I'm not sure.
Likely, yes.
Yeah.
And I will confirm I've been in contact with all of the impacted grocers, and I will just triple check that they're okay with me providing that full list of what businesses we're speaking about.
Yeah, I'm just trying to get a little bit
Sure.
picture.
Yeah, and the size of what they are.
Yep, 26,000 square feet when we were
500.
looking to craft this is the largest footprint to ensure that that largest business would be able to still have access to renewing their tobacco retail license. And then the other 7 storefronts are under that square footage.
Yes, Representative Daigle.
I had a discussion with one of these store owners this morning, and I know them very well. They're from my hometown, and they're going to have to make a decision if this doesn't go through, whether to discontinue tobacco sales or discontinue pharmacy sales. They run on a tight margin, so this would definitely have an adverse effect on them. So that's their concern, and this bill is going to address that. Am I correct?
That is our intent, yes.
Okay.
Thank you.
I was going to say, was there a question?
Are there any further questions? Are there any further questions? I'm seeing none.
Thank you for
so
your
much
time.
testimony. Yeah. Any further testimony in support of this legislation?
I feel a little rusty. This is my first time testifying in person this session, so.
We're glad you're here.
Senator Ingwerson, Representative Meyer, and members of the Committee on Health and Human Services. My name is Amy Downing, and I'm the Executive Director of the Maine Pharmacy Association. We represent licensed pharmacists, pharmacy technicians, and student pharmacists across Maine. And today I'm testifying on behalf of the several independently owned pharmacy members who are in support of passing LD 2134, as it will help ensure they can keep their doors open. These pharmacies are not part of large chains or corporate health systems. They are locally owned small businesses that serve rural and underserved communities and remain viable by leasing separate space within independently owned grocery stores. Pharmacists play a critical role in public health, including tobacco cessation, disease prevention, and patient counseling. And for that reason, legislation involving tobacco sales is something we approach with caution. And generally, I wouldn't really be here, but this does affect my independence. So last year, the legislature passed LD 166, and it became apparent that there were unintended impacts for the smaller independent pharmacies, specifically those that lease space from independent grocery stores. And LD 2134, as it was stated, is a narrow and targeted fix to address those impacts. So this bill does not permit tobacco sales by pharmacies, nor does it alter Maine's prohibition on tobacco sales within pharmacy premises. Instead, it applies only to situations where an independently owned and licensed pharmacy leases separate space within an independently owned grocery store. In these arrangements, the pharmacy and grocery store are entirely separate businesses operating under separate licenses, leases, inventories, and point-of-sale systems. In rural Maine, these co-location arrangements are often the only way an independent pharmacy can remain open. They allow communities to retain access to prescription medications, pharmacist counseling, immunizations, and other essential health services. Many of these pharmacies also provide home delivery services to their patients, which would also be lost if they were forced to close their retail operation. For patients, this could mean longer travel times, reduced continuity of care, and the loss of one of the most accessible healthcare providers in their community. LD 2134 addresses this issue responsibly. It includes strict eligibility criteria, as you heard, and these guardrails ensure the bill does not weaken public health protections or expand tobacco access through pharmacies. While we remain committed to reducing tobacco use and supporting cessation efforts, we support LD 2134 as a limited and practical solution to protect independently owned pharmacies and preserve access to healthcare services in Maine's rural and underserved communities. We respectfully urge the committee to support this bill.
Thank you for your testimony. Do you have any questions? Curiosity, last year, did you have a position on LD 166?
So we didn't, and I think what happened is, which Christine, you can refresh my memory as well, but so generally, I think with the original bill, I believe there was a fiscal note, and generally, I think in the past, because of the fiscal note, it would go to the Appropriations Committee and wouldn't have been passed. And so I think my members were just, it was kind of went under the radar a little bit. And so it kind of caught us by surprise a little bit.
Yeah.
So.
Thank you. Yes, Representative Zager.
Thank you, Mr. Chair. Thanks, Ms. Downing, for being here. So what I'm hearing is that the pharmacists and your members are in a quandary. Pharmacists have come before the legislature many times asserting to be healthcare providers, expanding immunization, et cetera, in pharmacies. And the legislature has largely gone along with that, to some degree. And healthcare, obviously, you've described that tobacco, is helping people gain access to tobacco is contrary to health. Among your members, what sort of discussions, disagreements are there as people come out on different, across the spectrum of what is arguably a moral hazard, where you can't do, it's not a right and a wrong, it's a right and a less right, or a wrong and a less wrong, where you don't feel good about that.
Right.
And so can you describe the discussion among pharmacists who have said that they're healthcare providers as they consider increasing access or not diminishing access to tobacco products?
So with this issue specifically, it's not the pharmacy that's selling the tobacco. This issue is about independently owned pharmacies that lease space, and they are at risk of losing their leased space. And the concern is that in many of these communities, you know, they would have to close their doors if they lose this lease agreement. There isn't necessarily another building that they could move to or lease, or even property or land that would be available for them to buy to build, you know, a freestanding, again, these co-location arrangements, as I said, are important to these small communities.
So their, okay.
Yes.
So their consensus is that we're not selling the tobacco. It's happens to be occurring in the same building we're in by our landlord.
I would say that our consensus is, the overall concern is access to pharmacy care in these communities. That's our concern.
And that, okay, thank you.
Further questions? Seeing none?
May I?
Yes, go ahead.
And do we have information on each of these 8 communities where there is a co-located pharmacy? Do we know its proximity to the next pharmacy, or?
We can probably get some information for you on that for the work session. And in speaking with one of my independents today, you know, they have indicated that moving prescriptions to a pharmacy that's X number of miles away isn't necessarily that's not something that works. It's not as easy as it sounds to just do that, but I can certainly work to get information for the work session.
Because my concern here is that, you know, I fully understand access to pharmacy, particularly in rural areas where pharmacies are offering vaccinations, immunizations, and all the range of, as Representative Zager said, the legislature has largely, at least the 4 terms I've been here, recognized pharmacists as healthcare providers and increase the scope of their. So I understand limiting access to pharmacy in rural areas of our state is concerning. I just want to make sure that what we're dealing with here is actually the eventuality of that we are not simply dealing with independent pharmacists who are co-located in a grocery store selling tobacco, for whom that arrangement is a good one. And but that we are actually dealing with pharmacies that are the only game in town for some, for the people who live in that area for some distance around that pharmacy. I mean, those are just the thoughts that are coming to mind as we,
and
begin
just
to
as a
think
note
about-
on that, you know, it's not just one person in that pharmacy, right? They have staff. So when we're talking about the potential of this pharmacy closing, that's the loss of jobs as well in these communities. It's the staff that works there as well. So
understood.
Yeah.
So you can get us some kind of a map that actually shows us in these 8 locations.
You want a map? We'll work on a map for you.
I love maps.
I know. I
Even
can
just a
tell.
physical. What are the distances to the nearest other pharmacies in those
Okay,
locations?
we'll work on that.
Yeah, I think that's what you're asking for, right?
That is. I'm curious.
Previous.
Yes, I think we asked it once before. Yeah.
Okay, good.
Are there any further questions? We're getting a map. I'm so happy. Thank you.
Thank you.
Any further testimony in support of this legislation?
Anybody on Zoom?
Is there anybody on Zoom on this one? Yeah, which one is it? This one, the enforced townhome. Yeah, we have, this is 2134, correct?
Yes.
Yeah, we have one on Zoom, Brett Danforth
In favor?
in
Yep.
favor. Yep.
Good afternoon. Can everybody hear me okay?
Yes, we can hear you, Brett. Just want to remind you that we do run a 3-minute time clock in this committee. So anytime you're ready to start.
All right, excellent. Thank you. Good afternoon, Senator Ingwerson, Representative Meyer, and members of the Committee on Health and Human Services. My name is Brett Danforth, and I am the second generation owner of two independent grocery stores, one in Herman and the other in Pittsfield. My father and mother opened our location in Herman in 2007 to a community that was traveling to Bangor for all of its needs. The store dramatically improved the quality of life for the community, inspired further retail development in the town, including medical and dental offices, a hardware store, and banking institutions. In the fall of 2015, we expanded our offerings within our store by leasing space to a local pharmacy, which has proven to be highly appreciated by our customers and surrounding communities. Prior to this pharmacy opening, members of the communities we serve, Herman, Carmel, Levant, Newburgh, Stetson, Etna, would need to travel anywhere from 15 to 30 minutes further to the nearest pharmacy. If LD 2134 is not supported, this critical access point for both food and healthcare will be in jeopardy for the small towns we serve. The recent changes in Maine's tobacco licensing laws are putting a large unnecessary strain on our already fragile business. Any legislation that prohibits us from selling lawful products is highly concerning because it's not just the loss of revenue on that specific product, but also the additional items that would have been purchased during the shopping trip. It is commonly understood that people do not wish to make multiple stops for their goods and will find a different place to fully shop for their needs, in turn changing their shopping loyalties and removing a portion of our customer base. The expected size of this impact is large enough to make me question whether we should maintain our tobacco license and continue to offer all the products our customers expect, or if we should continue to support the health needs of our community by leasing space to a local pharmacy. Unfortunately, without the passing of LD 2134, we will not be able to do both. In this scenario, two local small businesses are negatively impacted simply because they coexist within the same four walls. We do not share inventory. We do not use the same point of sale system. We have separate licenses. We are separately owned and operated. In our small town, it would not be viable for the pharmacy to operate in a standalone building. The population is just not large enough. It is our lease agreement and appropriately sized space in our store that makes it possible for them to serve this rural community. I respectfully encourage you to consider LD 2134 as a fair and just solution that will allow small, locally owned businesses to serve their customers to the best of their ability. Thank you for the opportunity to testify and for your service to the people of Maine.
Thank you very much for your testimony. Any questions? Seeing none, I appreciate you coming before us today. Thank you so much.
You.
Any further testimony in the room in support? We don't have any more on Zoom. In opposition? And neither for nor against.
No, it looks like.
Opposition?
Yes.
Okay.
Good afternoon, Chair Ingerson, Chair Meyer, distinguished members of the Joint Standing Committee on Health and Human Services. My name is BJ McAllister, and I'm testifying on behalf of the Campaign for Tobacco-Free Kids today in opposition to LD 2134. Tobacco remains the leading cause of preventable death and disease in Maine. Each year, 2,400 Maine adults die from their own smoking. Maine still has significant youth nicotine use, including 16.4% of high school students using e-cigarettes and 5.6% smoking cigarettes. The financial toll is enormous. Maine faces $942 million in annual smoking cause healthcare costs, including $281.2 million in Medicaid costs and additional $1.5 billion in productivity losses. That's why the Maine legislature's 2025 action to end tobacco sales in pharmacies and in retail establishments containing pharmacies was so important. Even with the conditions in 2134, this is still a rollback of a principle that was established just last year. There is a clear, unavoidable conflict between pharmacies' roles in promoting health and the sale of products that kill nearly 500,000 Americans every year. A store containing a pharmacy remains a health care touch point for families, older Mainers, and people managing chronic disease. Allowing tobacco sales in the same establishment sends a wrong message, normalizes tobacco use, and undermines cessation efforts. We understand the concerns raised in some rural communities. I, in fact, grew up in a rural community with one of these types of pharmacies, and they are embedded within the store most of the time. It feels like one establishment. There are ways to address this, and other states have done so. States like North Dakota and Iowa have used telepharmacy models to keep a pharmacy front door in rural communities by allowing remote sites to be supervised by off-site pharmacists through secure audio and video systems. States like Wisconsin have explored and advanced approaches that strengthen rural pharmacy capacity through incentivized and support models, including programs designed to place and retain pharmacists in underserved areas and modernize rural dispensing systems. Using narrow, health-focused solutions rather than rewriting tobacco licensure policy. If lawmakers want to address a small number of situations, the better path is a limited case-by-case health access strategy using tools like rural health infrastructure, pharmacy access grants, and other targeted interventions, without creating a statutory carve-out that weakens tobacco-free pharmacy statewide standard. Creating exception in statute will invite pressure from broader carve-outs over time, and we've seen this time and time again from the tobacco industry. Therefore, we urge the committee to vote ought not to pass on LD 2134 and are happy to answer any questions.
Thank you, BJ. Thank you, BJ, for your testimony. Any questions? Representative Zager.
Thank you, BJ, for being here.
Yeah.
Can you please elaborate on the health-focused solutions? You gave a few examples. I'm not exactly, if you could just kind of put that in motion.
Yeah.
So you have, the pharmacy, small pharmacy, small pharmacy in a small store. And what is the rural health infrastructure funding grant or other targeted interventions? How is that going to help them survive if they can't do the continued arrangement that they've had?
I think what we're hearing from the testimony of the proponents is that there is this internal conflict that's happening where there's a revenue that the grocer is getting from the lease sale, and there's a revenue that the grocer is getting from tobacco sales. And now, as the law is currently drafted and in place, those are in conflict. In states where there have been difficult dynamics to open pharmacies, where there might be a pharmacy desert, these states have explored grant programs that help bolster the pharmacy. So I'm not going to stand up here and advocate that the lease should be, the cost of the lease should be raised for the pharmacy, but certainly if there was an increase in the cost of the lease that offset the tobacco sales, then there could be a grant program to help the pharmacy survive through that. But what doesn't seem like a fair choice is when these pharmacies are existing within the same four walls as a place that's selling tobacco, because the legislature just last year said that wasn't a situation they wanted to create. So I think that there are ways to help support these stores and keep these pharmacies in place that don't involve the sale of tobacco products.
Okay, thank you.
Any further questions? Seeing none.
Thank you for your time.
Further testimony in opposition?
Senator Ingerson, Representative Meyer, and honorable members of the Joint Standing Committee on Health and Human Services. My name is Julie McDonald, and I am the Maine Government Relations Director for the American Cancer Society Cancer Action Network. And I'm also testifying today on behalf of the Maine Public Health Association, the American Lung Association, and also the American Heart Association. And we ask you to oppose LD 134 or 2134. Our organizations were very proud to support all iterations of Representative Moonen's bill to end tobacco sales in pharmacy, including LD 166, which this bill seeks to amend. While we appreciate the concerns that led to this legislation, there remains a contradiction in profiting from the sale of tobacco products, a leading cause of preventable death in the United States, in the same setting where healthcare is provided, even when housed in a grocery store. Ending tobacco sales in pharmacy is setting an intention, and it is a step towards reducing smoking normative culture there are economic consequences to moving forward, and that does not negate the policy. The National Association of the Board of Pharmacies, NABP, has issued the following statement, and that is that it is an inherent conflict of interest for pharmacies that dispense medication to treat heart disease, lung disease, and cancer also sell tobacco products. And so we urge the committee ought not to pass on LD 2134. And I did just want to point out in response to Representative Zager that over the summer when this was being discussed, we were provided a list of what I believe the grocery stores are, and I believe that just 3 of the 8 pharmacies are the only ones in that town. So that if they were to be removed, which I would hope that the grocery store would choose to stop selling tobacco, that only 3 of the 8 in this bill would be the only pharmacies in town. So I hope that if you do move forward, you look very closely at narrowing the exception. Thank you.
Welcome. Thank you. Any questions? Representative Graham. Representative Graham.
Thank you, Mr. Chair. Thank you, Julie. I really appreciate it. As you know, I worked for the American Cancer Society for many years. And at that time, the highest incidence of cancer in Maine were in the very rural counties of Aroostook and Washington County. And my question is, does that continue to be the case that these rural areas are highly impacted by particularly lung cancer?
Yes, that continues to be very true. Rural areas are more impacted by the use of tobacco. And in general, 1 in 5 deaths in Maine can be related to the use of tobacco.
Do you have information on those 3 locations compared to the total 8 that were mentioned that you could give for the work session?
Yes.
Okay, thank you. Did you already ask for that?
No, he said that. I'll get a map.
I get 2 maps now. Any further questions? Thank you.
Thank you.
Yeah. Any further testimony in opposition? Testimony neither for nor against this legislation? Seeing none, that ends the public hearing on 2134. Are there any further requests from the committee for the work session on this bill? Okay. Well, that's good. And Anna, do we have anything this afternoon? No? See nothing. Okay, I'll see you all tomorrow morning.